you know, people probably vote for more detail
Do y'all
that
do
we've
a-
gone into.
Do we do the little daisy pins for the nominees like the UMC or?
I don't know of them doing that.
So you should, huh?
It seemed like there was something
Let me,
that I heard when they started setting that up.
let me ask that, cause I'm on that team,
There's a bunch of them in there.
and I don't know what's on this
Yeah,
paper.
at
They
UMC,
do, your pins are
everybody got
on
a
here,
pin.
miss.
Oh,
Oh,
well,
down there?
look at that.
That's
I
where,
had opened it.
yeah, they're on there.
Okay.
And they have Madison Curtis,
Oh,
Dana Peavy,
and look,
Kim
it
Barnes.
might have been,
Rachel McMillan.
it may have been previous ones. I know Rachel was this time. Some of the other ones may have
Cool.
gotten it on the other ones,
Does it have the
but she
letter?
gave them all to me this time.
Oh.
I mean, she gave
It
them all
should be
to me
back.
last week.
When at River Oaks, they actually got the card that the patient wrote on.
Yeah, here's
it?
the, let's just read them real quick. Madison goes above and beyond for my son throughout her whole shift. She's very loving and caring and literally checks on my son every 30 minutes to make sure he is okay. She even makes sure I am okay. Madison is amazing and I am thankful God bless my family and I with her. And then somebody else said Madison was our night shift nurse. She clicked immediately with my 19-year-old daughter and instantly Ella was more at ease with the change of shift nurse. Words cannot express how impressed we were with the skill and compassion we received that night. I'm proud to be these nurses' colleagues. So we know that was Ella Bailey. Her mom works here, Nicole Bailey.
I didn't know Ella was up here.
Uh-huh.
Is our off week.
Yeah.
Yeah, it was on.
Anyway.
So I was, cool. Anyway,
Sweet.
you wanna read the
Oh,
one
this
you
is another
got?
one from Bailey.
Yeah, read
This
it.
is for, my 19-year-old daughter was admitted very unexpectedly for an abscess tooth. Ray and Dee were exceptional in making her less afraid and nervous. They were great IV starters and allied all of her fears by incorporating her into the plan of care and sharing the decision-making process. Love her and Dee. That was really what should have been to both of
I
them.
know it should have been. I'm gonna ask, I'm gonna make notes. I'm gonna ask Bobby about D.
Because that was, she was mentioned. And this was for Dana.
Robert, you wanna grab a chair from
My 14-year-old daughter, Ben, has really, hold on. My 14-year-old daughter been on floor B since Friday. Miss Dana has really been a really big help working. Night helped us out, very awesome. Been a really good nurse. Doing WAT, what she gotta do. I wanna say we thank you for everything you have done. I'm trying to figure out what this is saying.
Bless it.
For my daughter. God and a blessings to your heart. Y-O.
Oh,
All right, what's that name? I'm wondering if it's the same.
bless
one.
it.
This one's written, says Dana P.
No, look at the back. I wanna know if it's the same.
Val,
Yeah.
Lauren,
Oh,
Lala.
good.
Because whenever she was
I was
reading,
like,
I'm like,
"Oh."
this sounds like my writing here.
So who's that one to?
Me.
Okay,
My 14-year-old daughter, Ben, has really went. No, okay, it goes
Yeah, it
this
goes
way.
cross.
Okay. My
Right there.
14-year-old daughter, been here since Friday. Miss Kim has really went beyond making sure she was good. She patiently explained things to us. She always came in to check on us. She stood out as a nurse, willing and able to go beyond the normal call of duty. Thank you for the awesome job, Miss Kim.
that's amazing that we've gotten this many. I mean, that's really great.
That's
So,
sweet.
if we ever need any more, do we have a thing on our desk down there? No. Some units do that don't have them out in the hall down here, but I'm since I'm on the committee, I've been refilling them, you know, so that they're out by the elevators. If y'all ever notice it as you're coming and going, if they need refilling or if you see any in there, y'all just shoot me a text and I'll come pick them up. But thank y'all so much. we know we have daisies on the unit, but I'm glad that other people are sending it in, cause it does take an effort for people to do that and send it in, so that's, you wanna sign in? That's awesome. Since Robert's here, does everybody know Robert? Kayla?
I
No?
know.
Well, I know this is my first time to meet you as well. I think I may have seen you in passing, maybe even when you started. I go to new employee orientation, so that may have been where I saw you, just coming down there and speaking to the group. But, this is Robert Sutton. He's our, program director for our burn. We're not supposed to say center, but our
Not
burn
yet.
program. But, so anything else you wanna say about?
I wanna thank you guys
Yeah.
for taking care of our patients these last few months. I know it was not easy. And I wanna apologize for Dr. Colleen yesterday. I don't know if it even made it to you guys. I know it made it to Jennifer. I called her bright and early.
Well, you know, I called, and I wanna call Madison and I wasn't fussing at her at all. I was just calling to say, hey, how's the patient
Yeah.
doing? What went on with the
What
patient?
happened, I talked to him later. What happened was he went down to Holding to sign consents, didn't see an IV, and then just didn't even bother to look. So his
There
head,
wasn't IV.
there was no IV.
So he thought that, and so Robert had called me, and I just called Madison to say, because I was trying to catch her before she left, just to say, hey, what went on with the kid overnight? I know he went through she went through the ER, but I was thinking they had checked in the ER. So I called Amanda Sue and just did this is on my way to work, so I can't look in Epic, and, Amanda Sue looked and said, we don't have an encounter on that
Yeah.
child, the kid didn't even check in. EMS literally
That's
came
what
through
they've
our
been doing.
hallway with the child and went upstairs. Anyway, they did have an IV, did get the fluids. Robert was at a symposium yesterday, so anyway,
Yeah.
it was all good. I hope that Madison didn't think
And
anything about
She
it.
was, the kid did not have an IV when they arrived to the
To
floor,
the floor.
Yeah.
even though it was
And
ordered at the other ER.
And that's something
was.
that we do track that, just so you're
Yeah.
aware.
But they did, it was a very difficult, they had to get the ultrasound, but they got one before.
Yeah.
Yeah.
And ED, I think, came up, it was a
Mhm.
difficult
Yeah.
stick.
They had
But
to
we,
get the
you know,
ultrasound.
we call on ER, Rapid sometimes, or whatever we need to get it done, but, you know, when he said that, I was like, our staff surely would not,
They would have
not-
called. but
Yeah.
they wouldn't.
not have followed orders, so I knew something was, but since Robert's here, I know we've got a lot of stuff on the agenda, and it won't take a lot of time to go over a lot of this, but we'll let, we could go ahead and talk about, like, the burn program and the hands and stuff, if you wanna talk about
Yeah.
that and what the
I
plans
don't
are.
really know the exact plans because we keep talking about pediatrics. We are moving down to 1 North on the 15th. I don't know if we will strictly go back to the way we were, where all pediatric patients are on our step-down floor, or if we will continue to mingle some pediatric patients up here. I think you guys provide excellent care to our pediatric patients, so don't take anything I'm gonna say the wrong way. But with our burn patients, I do prefer a true burn nurse taking care of a pediatric burn, just because that's what they do every day, they know what to look like. I've got no problem training you guys if you guys wanna learn. I'd love it. You know, I also, at the same time saying that, I prefer a pediatric nurse take care of pediatric patients, so it's kind of a double-edged sword. So I don't see not having any of our patients up here. We'll probably have to look at it, maybe Jennifer and I, Dr. Cole and Jennifer and I, we'll just have to kind of look, you know, what do we wanna send to the pediatric floor? I really see you guys getting a lot of our hand injuries, maybe some small burns, things like that.
And that's what I was trying to tell y'all, it's not that we're not telling y'all the truth, and I was talking to Kim about that, we just don't know right now.
we
We have
don't.
had meeting after meeting, and we don't know, because he gets a lot of inmates with hand injuries from whatever they do in the prisons,
And
fighting
burns.
and shaking and whatever, and so we don't want those patients mixed with PEDS patients, because we wanna look out for our patients. And if that means putting them up here, then that's what we wanna do, to separate them, so they've talked about that a lot. We just don't know. We do know that we don't expect y'all to be critical care nurses, And we're not going to take any critical care patients right now because we're not equipped to do that. If we, Dr. Coleman, of course, is pushing to do that in the nearest future that we can, but we're no plans to turn you guys into critical care nurses.
No, those would be the ICU.
Yeah, that would be ICU nurses that we will hire, or if anyone up here wants to train to do that, we're willing to do some training toward that. We are looking at some training right now, and we talked about that the other day. You're gonna have to help me with that initial.
ENCCO.
Yeah, ENCCO. If y'all wanna look at that, I can send you the link. I've got it on email. It's a program that we can purchase. ERC has already purchased it for our critical care staff. We can actually purchase it for our staff now, and y'all could do some of that, not to be critical care, but to train for higher acuity. And we'll talk about that a little bit more in a minute, but there's things that we can do to help you train a little bit more. We certainly can't train for everything that's gonna come in, because we don't know what's gonna come through the door. There's no way we could possibly do that, but like Robert said, it's gonna be a day-by-day thing. If they're just swamped downstairs and we know the child and we're not busy and we know we can give them better care up here, let's go on and take them up here for their sake,
And I know you will probably get something that outside your comfort zone eventually. Call me. I can't always promise I'll drop what I'm doing and come in, but 9 out of 10 times I'm usually at a spot where I can drop what I'm doing and come in and help. If I can't, we've got Larkel. Her role is not really a clinical role, but she's very big on patient safety
and knowledgeable.
very knowledgeable. She is probably hands down, probably one of the best critical care burn nurses in the country.
What about at nighttime, like, cause during the day it's
Call us.
easy, cause they're night
Yeah,
people.
call us. I've gotten up in the middle of the night numerous times, so has Raquel. Most of our APPs will, I'm not gonna say all of them, but, and if you're not getting a provider here at night, call me. I've told all our providers, including Dr. Colden, Baptist expects a provider here at 2 hours max
When you have an
when a
admission
patient gets
in.
here.
Cause we've had that discussion.
Mhm.
I mean, and it's I know that it makes y'all very nervous if you get a patient in. I know you were here when one came in on a flight, and then didn't see anybody, and you're like, yeah. Sorry, Kayla, I wasn't sure who else was here, but, so we've talked about that, and we understand that, I'd be upset if it was my child, I think.
And
Robert would be,
that's kind of the push
and-
I've pushed on it,
Yeah,
is that in past, we did not do that because we had highly trained burn nurses that have done burns for, 10 plus years. So they knew what to look for. They knew how to talk to the parents and could explain to the parents the process of what was gonna happen over the next, 12 to 24 hours. Nobody expects you guys to. So that's where I've told Dr. Coleman, if you're gonna accept a pediatric patient, somebody has to come in. And if you can't come in, then just don't accept them. It's that simple.
and he came in night before
But
last.
he did.
And I think, like you said, the APPs, they, it's not
Depending-
that often.
Yeah,
but,
it's really not, and that's what I've tried
You
to
know.
explain to them. They've gotten a little spoiled
Yeah.
over
and
the
it's-
last 8-9 months.
And when we're gonna talk a little bit more about the trauma program, but once we get it up and running and everything in place, anything that's over a 10% burn will activate the trauma, and they will go through the ED.
And then there's some
Yes,
conditions
they
to
will.
that, if it's
Yeah,
airway.
Yes. So, that,
So if they call us
They will.
report and they say it's more than 10%, we tell them they have to go to the ER, once it gets in place.
Well, it's
Well, it
more than just
shouldn't.
percent, isn't it? Like area, like genitals is automatically,
yeah, there's certain
Well,
criteria.
Not so much on trauma activation, that is on acceptance, like this genitalia over a major joint, there are, no matter what size the TBSA is, it automatically classifies as an admission. The trauma activation is kind of new to us, but I don't think it's over sites now there are some things like airway, there's an airway issue, Yes, greater than 10% activation, any other injuries or comorbidities, activate. So we'll get that out once, Michelle actually tells us the details, and she's putting that together now.
And Dr. Coleman would prefer them to go through the ER.
Yes.
Our ER has been such a chaotic mess the last year. I'm sure, you know, I know y'all are kind of separated from that a lot, but it's been so bad down there that they have asked that they not go through there. But we're asking that pediatric patients at least be able to go through
Our
there.
model
Yeah,
is, and always has been, till we got here, all patients that come in after hours or when there's no provider here, makes just a pit stop in ED so a provider can just lay eyes on them and make sure what the referring facility told us is true, because 9 out of 10 times it's not. They're either
Right.
gonna oversell it to get us to take it, or they're gonna undersell it to get us to take it. So it's always kind of shot in the dark. We're
So-
working on that.
I just want y'all to know that what you're saying or your concerns have been heard. We're trying to work through the process. It's been, like Robert said, I mean, it was a culture change for them coming here. You can imagine bringing their whole practice to a different hospital. They've completely had to redo their way of work. And, so we're trying to all learn how to work that together and work it out, and it's going as smooth.
It's going,
I think,
it's
yeah,
going.
as smooth as it could go, I think, when, we've all worked together well. So we're trying, and I just want y'all to know that you're being heard.
And
And I
every
think-
time you guys say something,
Yes.
Jennifer does reach out to me or somebody.
Yes, I just, you know, and Amy's reaching out, and so it is being heard, and something, I'm straight to admin, like, before Robert was here, I was in admin, we've gotta do something, you know, it's just taking time for us to try to work these kinks out. And as far as hands, if we get some hands, those might be more of what we see. If we need somebody that needs a one-on-one, and I know, Teresa, you were here when we used to do one-on-ones for Dr. Purvis. You remember,
Long time ago.
long time ago.
But we had a lot more staff back then.
Yeah, we did, but we had a lot more patients
We
back
did,
then.
exactly.
We had a 25-bed unit
We
back
don't know
then.
more, yeah.
So we had a lot more patients, and, but if we need a one-on-one and we're able to do that, then, you know, we'll do it. Because we've got the monitors. One North does not have any monitored rooms right now. So we wanna provide that for the kids, if they need to be on a central monitor. Maybe it's not a one-on-one, but they do need to be monitored. We have the ability to do that. So, and we want the patients, you know, so those are the type things that we're gonna be looking at, Robert and I,
And,
case by case.
and on that, you know, I've taken the physician, the providers out of the one-on-one decision. That, in my opinion, is the nursing decision. So anytime you guys think, I mean, give Jennifer, call me, I've got some algorithms that we've used over the years that kind of dictate whether or not the patient should be one-to-one. But then you also kind of gotta look at other things, you know, nurse's ability, what else is going on the floor. So, but,
So what is the backup with that? Like if we take a one-on-one and then we get a call that we're getting a RSV, you know, whatever, I'm just trying to figure out how the logistics would sort of kind of work.
Well, you're gonna have 2 nurses here.
Right, definitely.
So
But if you
if
have,
we say a one-on-one, you're not literally going to have to sit in the room with the
Right.
patient. Now, we did on
Yeah,
those
so we did back
one-on-ones.
then.
On those one-on-ones,
We
we
had
sat
double
in the room
rooms,
with
we had
them.
double rooms and we were, yeah.
Yeah, and we had a glass between them that we built out. Before then, you literally sat in the room with the family and the patient
yeah.
with the desk. But one-on-one would be more like the Q 15-minute checks. You're going
Right.
to be in there extremely
Just,
frequent.
yeah,
Because like he said, telling us the other day that they wouldn't take Q 15-minute checks on the floor. Those patients had to go to ICU. Well, we really could do those up here, you know.
right.
One of y'all could get in a room to do 15-minute checks right now. I mean,
Yeah, and that's the thing, right
Even if
now,
you
it's
got
no
a-
big deal. And it's just like whenever, I just wanna know, and this, they're using me as the spokesperson, because it's like everybody's asked a lot of questions on that there. Because it's like a revolving door at times,
we can't work on the what ifs.
right? But I'm just saying,
If this happens,
they
what do
just
we
wanna
do?
know that there's some type of provision if, and I know we're not gonna work on it, we're gonna plan on taking the patient, giving
Yeah.
optimal care. That's the plan.
Yeah.
But in these nurses' minds, they have to know that, okay, they're not gonna leave me hanging if then all of a sudden I get this and I get this and I get this. There's gonna be some type of a backup plan. If this happens, we're gonna pull someone from here to do whatever. You know what I'm saying?
Well,
I'm
I
just,
think
right
they're
now-
concerned about the TNAs and the dental patients that, and the MRIs that, I don't think in our census, when people look at it, you don't
They
see
show
how
up.
much work is involved with turning all
I
that
know the
over.
turnover, I do. You might not think I do.
oh, I know.
Because when I was on orthopedics, one nurse might take care of 16 patients in one day
Right,
because of the in and outs of the whole day. But the patients right now, if you saw
The
what people
acuity
did
is
on
not-
other floors.
Oh, we know, I mean, cause we know.
I
things.
just don't.
I think
it's
our
just-
issue too is, and this is not really a what if, cause it happens, during RSV season,
Yeah,
we could have 2 or 3 that are on continuous,
yeah,
high flow oxygen,
okay,
and then if we have this 101, yes, it's Q15, but these other 3 are pretty much,
yeah.
you know, Q15.
Okay.
That's the
All
situation
right, so let's
that
say
we're
we
concerned
had
with.
3 continuous and a 1-on-1, okay? Well, this 1-on-1 really may not be as much of a 1-on-1. We may say, let's do Q15-minute checks for 4 hours, and then we may bump it to Q30 or whatever. We'll talk this over, you know, and work that out. If you need Amy's help, Amy may have to come over here. I may come up here. You know, when we had the big unit, Teresa wasn't here every day, but there was plenty of times I went up and helped with vitals or IVs or whatever needed assistance during a certain time period.
that's what I
You know,
think the staff needs to know,
We,
is
you know,
that
if we
there's
need to
gonna,
call and say, Kim, could you come help us out for a couple of hours today? Teresa, we're swamped, can you help us out for a couple? Maybe you can't, but we're just gonna rely on our resources.
And if it's one of
You
our
know,
patients, call me.
You know,
I'm
And
glad
then,
to come
and then
out.
too,
You know.
especially after 3, whenever the secretary leaves, even when we're not really busy with
Yeah.
critical, the door, the phone, I mean, it's hard to, cause you're in a room,
Yeah.
and then you have all these people calling you, and then they get pissed cause we don't answer the phone, and it's like,
Well,
that's
you just
another
gonna have to
issue. I
look-
mean,
I know,
and the door
You
door's a
can't.
big issue.
you can't let that.
And we just
go.
let it ring, and we just let the door ring.
Yeah.
I
You
mean,
don't
so,
have to.
I mean, if y'all hear,
You take care of your patients.
we do,
And you let the other just, you can't let
cause I
that
mean, it's
stress
not
you
we can
out.
do, okay, 'Cause just, so if you
I
get calls
know.
saying we're not answering the phone, that's the reason.
Yeah, I know, we don't have a clerk. I mean, we can't do everything. They're taking care of patients. It's okay.
Okay.
Don't let
Question.
that stress you out.
So at night, when we've got higher acuity patients and, burn units downstairs in one north, and there's 2 peds nurses, and we might have several patients, and we have to take a patient to the treatment room for an IV. Both nurses might be tied up for 30, 40 minutes in the treatment room.
Okay.
Should we be calling the supervisor to come up and sit at the desk while we're in
I
there?
would call the supervisor and just at least tell them, can somebody come up, especially if you've got another patient on the floor. If you've got 2 or 3 other patients and you're gonna be tied up in the treatment room, at least let the supervisor know, pull a PCA over here to at least be at the desk to let us know if there's an emergency or someone needs us. Or rapid response could come sit if they're not tied up. Someone to come over to let y'all know if something goes on. Is that,
Yeah, because
Good.
right now we just go in there and we do what we gotta do. And
If you
sometimes
prop
we'll
the
come
door
out
and you
the
feel
call
like
light will be
you can
on, and they'll
hear-
be mad because we, the call light's been on for 30 minutes, and we
Yeah.
have to explain to them, you
I
know.
wish there was some way the call light could ring in that treatment room.
Well, I mean, when we're starting an IV though, we got to
Yeah.
ignore it anyway.
Yeah.
You can't hear, yeah.
And we don't have the papoose boards, you know, like to strap a baby down for IVs.
And we
And we need
used
them.
to,
We used to have several.
yeah, if we need to get some, we can do
We
that.
need to get some.
Yeah.
That would
I
help.
It's
didn't
a
know that we
safety
didn't
issue.
still have those.
We've been using the sheets,
need-
and that works, but they can get out of that sheet so easily.
We
Um,
need the baby size and the toddler size, definitely.
Yeah.
The bigger school age size, we could probably do without. We didn't
Yeah.
use those much at River Oaks, but the little ones we used every time.
And I apologize, I didn't know we did not still have those, so, yeah, I'll work on getting those. So with the hand patients, you know, I know everybody freaked out about the leech stuff.
It was
So
the
I wanna-
heparin that freaked me out.
Yeah, I was
haven't
going-
done continuous heparin in 20 years.
Okay,
Exactly.
Kayla, did you get to see the leech therapy?
I saw the paper on the policy.
Okay, you
I
didn't
was
get to
gone,
see
I was
it,
out of
okay,
town.
and you were not here, okay. Do you wanna talk a little bit about it while you're in here?
Leeches are they can be very scary, they can be very time consuming. But if you can get over the gross factor, it's really very simple. Me personally, I put some gloves on, I grab the leech, put it there. If they don't grab, take a needle, just kind of poke the finger, to get a little bit of blood flow, put it on there, they'll grab. If you can't touch the leech, you can use some forceps, or you can use, a lot of people will take the syringe, pull the plunger out, put the leech in the syringe, and then just hold it.
Oh.
Right there, until they attach. And it's another way of doing it, but
Well, you know me, I'm gonna run my mouth about this because I feel very hurt about that situation.
Okay.
And I want y'all to know the whole story,
okay.
because I did not refuse.
No,
The
I think
patient.
he knows.
Yeah, I think, we did some
And-
research, and I
and
think
that
it's
was
good.
the
It
thing.
wasn't,
I wanted to learn and I went and learned. You know what I'm saying? We had another patient and I got my feelings very hurt over that because I will do
it was a
anything for
lot of
anybody.
There
miscommunication,
was,
and we're gonna
And-
talk a little bit more
and I found out
about,
even more that I never even.
okay. It was a lot of miscommunication, and we're gonna talk a little bit more about, the physicians and stuff, so.
And I'll kind of just say this. It was side conversations on provider levels that
Yeah.
were overheard and not really taking it full context. So it really didn't have anything to do with you guys.
Yeah,
But I feel like, even though I hear you, but I still feel like that we were looked down upon because we didn't do that. And I'm like, but I felt like I was very justified in saying, I don't feel comfortable with this, but I'll go learn. But I just don't feel like that we were very supportive.
I'll be
I agree with
100% honest. You were looked down on for all of about 10 minutes.
well, that's why I got,
Jennifer
that's why I wanted
got
to talk to
involved.
you.
Well,
Jennifer got
not just
involved.
you,
That's why I wanted to talk to you.
because I care what my coworkers think
Yeah.
too. Y'all have to deal with me. You know what I'm
Yeah,
saying?
Jennifer
But,
got involved, she
um,
did some research, she got with me, we put the information I'd learned, the information she had learned, and we knew exactly what happened. And it had really nothing to do,
We just want y'all to know, we're
had
not,
nothing to do with you guys.
we're not scared to do anything, but we want that patient, adult, kid, baby, whoever, to get the best care that they deserve to get. And with it being a procedure that we have never seen, we have never done, yes, we can learn that, but is that fair for that kid, for us to go in there and learn how to save his thumb instead of having somebody that's done it? That's my,
Yeah.
I wasn't even here, so I wasn't here.
Yeah,
That's what I'm saying, because if that was my child, and it was a procedure that Kim comes in there and she doesn't know what she's doing.
and as being a nurse, there are gonna be times, and I think Jennifer said this,
Yeah.
she's
Yeah.
had discussion, where you have to do something you've
Right.
never done before.
Right,
And I always tell the nurses that report to me, I expect you to work outside your comfort zone at some
Right.
point, that's how you get better. But I never also want somebody doing something that they're not capable of doing. And if you've never been trained on something,
Seen it,
and you've
or-
never seen it, never got it, I would kind of stand by you and say, you're not really capable. And that's where I would step in and say, hey, I can do this, I've got this person, let's do it together.
Right, and that's what we're asking, that's all we're
That is
asking.
what the plan was, but I think it just all went awry that day.
Yeah.
If the patient had come to the ped side, I think he could have been better taken care of from the ped. I'm not saying that they didn't do a great job with him, but the peds nurses had already connected with him. Okay, and then this nurse on this side come and do the leech therapy.
Yeah.
That's
Well,
what
about
the
the
plan
heparin
was.
though? I mean,
Well,
as I told
yeah.
you whenever I came down there, the leeches was one thing, but
Yes.
I was worried about, because I haven't done a
But you're going to
continuous
get
heparin.
stuff that you've never done, so this is where we need to talk about what were our resources?
Exactly.
So, what would anybody speak up and say, what would you do if you were getting a medicine that you had never done before?
Look it up, but then I would call somebody that,
Right.
especially heparin.
Exactly, I would have called pharmacy, I would have called somebody on another floor, maybe
Yeah.
that had done that, critical care, or, because I know they would have done it, but on these other floors.
We
That
need to
have done
have
it.
like a contact type thing, because like me,
Well, if you
yeah,
have
I
a
know
contact,
pharmacy, but
they're
I don't
not
know
always
who
gonna
to
be there.
call
And-
other areas.
and sometimes-
they're gonna be busy and,
But if I give you a contact of a nurse, they're not always gonna be there.
or a place or whatever. I mean, you know what I'm saying?
Yeah.
You tell me call
North or
AICU.
whatever.
Okay, call
This number.
3 North,
You know what I'm
3
saying?
North.
That we just, but I feel like that should have been,
So what if the nurse on this side had never done heparin? She had to have done it for the first time one day.
well, and I'm assuming that she probably was aware of it before. You know what I'm saying? If she had never done it, she didn't feel comfortable, then it would be like what happened Wednesday night. They would have had to either pull a ICU nurse up to take care of it, or the patient would have to stay in ICU till someone done the research and felt comfortable with doing
With
it.
doing it, yeah. Now, did you feel like the heparin needed to be in ICU? Is that what you're saying, or you're just saying you didn't feel comfortable?
I
with
did not feel comfortable with it.
it? Okay.
That cause I don't know, that's what I'm
3
saying.
North or 3 South, those are some units that do heparin infusions
Yeah.
frequently.
What are those units?
Cardiac and then a step down. I mean, not a step down, but
But if we
medical.
call them and say, hey,
A
we have a
medical.
pediatric patient, can you,
it,
will they,
leave the
okay,
pediatric out of
cause
it.
usually they say, oh, we don't do pediatric,
No.
okay,
A heparin infusion.
okay.
Well, walk me through, like, what do y'all do when you
It's
get the,
the
when you look
titrate.
for, what do
It's
you?
a titrate.
I can
A
start a
call-
heparin infusion and.
Draw the line.
Well,
it's
once they're
the-
up here,
the titrating
once they're up
is-
here, it should not be, they
Yeah.
should not be titrating.
Okay.
It should already be,
And
Or
I
it
think
should be
there's so
set- it
many
should be set
questions.
where
The
it's gonna be,
continuous
that we
heparin
didn't know.
policy says to get a bleeding times every so many hours and adjust up and down, and it's very complicated.
For what we use heparin for, we still run some extra labs, but we're not titrating. You
But
know,
do y'all have a specific, policy for y'all's use of heparin versus the heparin policy?
I did, but for the time being, we're following the hospitals.
So if
want me
it's-
to pull just the regular
So if it
policy?
says to, like, if you do the lab and it says to titrate, you're saying that y'all don't do it, but the hospital policy says to, so we're supposed to follow hospital policy.
But you still follow your orders.
Okay,
Yeah.
so y'all would do specific
So-
orders,
Yeah,
okay,
And they
specific
that's my
orders,
question,
yeah.
okay.
probably would have titrated it in critical
Right.
care.
Yes,
Or if they were not gonna titrate, I mean, if the patient came straight from the OR and they had it where they wanted it,
Mhm.
then.
Yeah, if you
just
follow
follow
orders,
orders.
we follow
Yeah.
those,
yeah,
of course,
it's
yeah.
it's basically gonna be run it at this
Do not change
for
it.
so many
Do not
days.
titrate.
Yeah,
Yeah,
Yeah.
that's fine,
Yeah.
that's great.
And then
That's
you
what
will
we
get
need.
another order, DC.
That's what we need, so we would not follow the policy.
No.
Because y'all would have your.
Yeah.
And you'll have it listed out exactly.
Because we're not
the-
using it
For
for
the-
the reason of
right.
cardiac,
Right,
the reason your
right.
policy is to.
That's what we need, is just specific orders, what to do, when to do it, when to draw
Yeah.
lines.
Follow orders.
Yes,
Yeah,
that makes us feel a lot better.
Yes,
Cause if you
It's
read the
not-
policy, it's up
yeah.
and down.
I don't, yes, and I didn't realize that y'all didn't realize you wouldn't be doing all of
Right.
that.
If you pull a
I
policy,
don't
it's a lot.
want-
So you guys can actually titrate
Wow.
outside of critical care?
Well, that's
Well,
why I
we're
was saying, I'm not.
Sandy had a burn patient 2 or 3 weeks ago that she was doing the titrating on the heparin on, and it was like, I was kind of paying attention to what she was doing, and I just got lost, you know.
So we typically have never titrated outside of.
Well, she was just following a hospital policy. I don't know how
need
the
to
order
look-
was
I need
put
to look
in.
into that.
And that's the problem, I
I
think,
see.
because we hear, and they're great, but I mean, we hear this,
Yeah.
and we hear this, and we hear this, and then I'm like,
I'll be
Oh.
honest, every policy and guideline that I've written for this hospital, we should not be titrating on step down, on burn step down.
In the case I was talking about, her case, like, the PTT was really high, and the day nurse had turned off the heparin, but in report, she told her that it was still running, she forgot to tell her that it was turned off, and then,
Yeah.
so when she had to restart the heparin because the next bleeding time was really low, and, you know, it was just, it was
So it was
something.
more on and off, it wasn't changing dosage.
Yeah,
Okay, well, see, I don't consider that
and then,
titrating.
well, if you're titrating it to off from.
Did she take it down slowly, or did she just go up and turn it off?
It was, I don't know.
Okay,
Yeah.
I need to look into that one.
Hey, sorry to interrupt. Hey, good morning. Your baby's crying. Can I give him medicine?
What's wrong with them?
He's screaming.
Oh,
And,
yeah.
and he was tangled up.
When did he have motion?
He
He
had.
had it at 412.
Do you mind? I mean, I can get into it.
It's Tylenol. I just didn't know if I can do it. I just didn't want to do it before.
You okay?
Yeah, I was just nervous. I just wanted to make sure it was okay.
No, he didn't have motion at 4. I pulled it, I haven't returned it yet, it's still on the
Okay.
bed cart. When I went in there to do vital signs, I wanted to have it, but he didn't need it, so I've got to return that. He didn't get it at 412.
Okay.
So he can have the Motrin.
Okay, so put the Tylenol back and give the Motrin.
He had Tylenol last, so we
Okay.
usually alternate.
Okay, I will do that. I just wanted to be on the safe side.
It's only
Thank
so
Okay,
you.
thank you.
Thank you
Okay,
so
thank
You can take care of them all day.
Okay, well.
She probably wishes she loved the babies.
I'm in a staff meeting upstairs.
And you will start seeing the policies, they're actually
Yeah, she
going to
came in here.
committee
Yeah,
next week.
she just
And
came
So
in
then
here
if
and
you'll
talked to us.
actually start seeing some burn
it's the fear of
specific.
the unknown.
Yeah,
I've been a
she
nurse
just
for
came in
38
here and
years,
asked us about
and
it.
it's like, okay,
Thank you, ma'am.
I'm
All
like
right,
on the end, and I'm not gonna screw up my license
Kyla
now
had
on
called
doing
her
something that I'm not for
See
sure
if she
about.
could get mad.
You know what I'm
Oh,
saying?
okay.
Yeah,
But then I just, yeah,
it's okay.
yeah.
And if
I
we
just
have
want you-
policies and orders,
Please,
we can do
if you're
that.
uncomfortable, call somebody. Call me and say, come up here and help me figure this out.
Well, as I said, I thought it was,
Call
I thought it
Robert.
was,
Call-
I
call
thought it
him.
was taken
You know,
care of. I did not know that there was
Just
still an
say,
issue.
come up here and help me figure this out. I don't, you know,
I'm gonna ask you a question.
okay,
Have you ever done the leeches before?
no,
So we would figure it out together.
yes.
Okay. That's what I mean. 'Cause
Yes.
Nobody's.
I'll be-
And I'll
I'll be glad.
I'll tell you,
But listen, Melissa, that, is that
she
what you're
loves,
gonna
yeah,
say?
she loves leeches, she's
So does
actually done
Sandy.
them, she's done them before.
Okay.
She was the only Baptist staff member that I found
And
that's
she,
done
okay,
them
she works,
before.
okay.
She used to be the supervisor. Do any of y'all know Melissa Ball?
Where does she work?
I bet you do.
Oh, the one that's over Burns
I
then?
bet
Yeah.
y'all do know
Over on
her.
Sea West
I saw her
Virginia.
yesterday.
Because she worked evenings. She was the supervisor. Now she's the manager. She's gonna be over Burns.
Okay.
And she was over SICU, which is now ICU
West.
West, which is the burn ICU. She did leech therapy at her previous job, one of her previous jobs. She loves it. She will come help anybody, teach anybody. That's why when the patient was here, I wanted everybody to see it because it's nothing like seeing it and us talking about it.
Yeah,
You
and
know?
there's I asked because I knew there was nobody. Oh, maybe you've been a nurse longer than I have, probably.
Yeah,
But like, have you?
I've never
And
seen it.
and the thing is, to my question, which we would do it, like we had to attach the leech to a thing. If it's not attached properly and sucking properly, how do we know that? How do we know it's working?
You'll know if it's locked on.
Okay.
If it's not locked on, it's gonna be crawling all over the place. If it stops moving, it's attached.
Great.
Well, and like
And
on
then
this
you
one,
gotta
and this was
account
one of the
for all of
things, it sort
Go
of,
in there and it's not on.
What if you
You
can't
gotta
find
find
it? What if you
You
got
gotta
that?
Follow a
account
blood
for 'em.
trail, follow the blood
But what
trail.
if, I don't know.
but
Yeah.
in it, they said, and I mean, it's just, it was little things, I'm like, oh gosh, I wouldn't have known this if I would have tried to do it, because, the leech did crawl, and he started attaching down here, and the patient actually said, I don't think it's supposed to be down there, you know, because that was where the incision,
Yeah,
well,
it needs,
I
it
wouldn't
needs,
have
it needs to be
known that.
distal. And
You
what,
know,
and what
it's
we,
like,
if nobody explains what we use the leeches for, is, typically most replants start getting venous congestion. You know, you get great arterial flow into them, but we're not getting the blood back out. So we need the leeches to help extract some of that blood. And also they, something with the leech, I don't know the mechanism, but they cause a heparin response.
yeah, sometimes
Because
it's
of
a
the-
saliva causes a vasodilator
Yeah,
type
something with their
thing, and I'm like,
saliva.
Yeah, there's something in that, yeah, actually causes like a.
I think it's super cool, but I
I'm
just
pretty
wasn't gonna do it the first time without,
Yeah.
And since you're in here, and since it's fixing to be summertime, and we're gonna get these hand injuries, anything that you have seen in the past that we may possibly get?
that we need to read up on, that we
Yeah,
need
let us
to
know before we get that
Well, I
patient.
mean, we don't,
Cause somebody said that
we
they
don't know.
cut their fingers off with hedgers, kids and
You,
stuff.
you see a lot of amputations, you see hands and grinders.
See, that stuff we need, before we actually get that kid on the floor.
We need to know what to do, what to look
Firework
for.
injuries,
Yeah.
which would be the
Yeah,
burns.
see a lot of
Yeah.
power, especially on 4th of July.
Right,
Which is coming up.
which we had some of those
If you
already.
can imagine, if you were making a show, the stupidest things you can do, you're about to start seeing them.
And we need to know,
Probably
I mean, it's
mostly
just-
boys, mainly
Yeah.
boys.
what, like, when they come to the floor as a direct admit or whatever, what do we do? How do we wrap it? What do we look, that's what we, I mean, you don't have to tell us today, but we need
I can tell you right
education
now.
on
That's
that.
the,
I'll take,
Yeah,
follow your orders.
But
Keep
a lot of times we don't
paying.
have orders until,
when they first get
yeah,
here.
when they first get here.
Okay, so what you're doing,
When
I
they walk in
so
the
what are you
door.
doing trying to set up?
yes.
Right. Until
Bleeding-
y'all get here to do
bleeding-
orders.
Bleeding control and pain. Your two focuses right there.
So do we
And
just
he
wrap them with,
typically
the-
does give pain orders
Right.
immediately.
like, what do we wrap it with? We just do Curlex?
Curlex,
No, but
Do we keep
Pores.
it moist or
At that point, no. I
Just
mean,
wrap
you
it.
put some kind of non-stick,
like Telfa
yeah,
or,
Telfa,
or the
window.
Xeroform? Do
Yeah,
y'all like,
something.
like I'm on burns, I know we like the Xeroform,
Yeah,
but
at the
on
beginning.
on hand injuries.
That right there, you could probably, until the provider gets here and looks at it, 4x4 is Curlex.
Okay.
Just
But that
something
matters
to
dry.
control the bleeding.
So that's stuff, that's the simple little easy stuff is what, which is not really simple, easy, but
Yeah.
that's what,
Yeah.
we
But
wanna
you
make
need
sure
to
that
know.
we're doing what we need to do for that.
Yeah, at that point, don't worry about, am I putting the right dressing on?
Just
Should I
wrap it.
use this? Don't worry about that. You'll get an order for that. Just control the bleeding.
Cause these adults that come as direct admit, their hand will be hanging here and they'll be pouring with blood.
Yeah.
And it's like, why didn't they wrap it? You
Yeah,
know,
stop the bleeding. That's,
Do y'all have questions from nighttime? Y'all aren't saying much. I know they're asking, but y'all are the ones that are at night. Are they asking the stuff that y'all would wanna know?
The information falls into the third category. You
What you
don't know,
don't
you
know.
don't know.
Yeah,
Yeah.
you don't know what you don't know.
right,
Right. If they come up and it's wrapped,
don't take it.
And don't take it off, that's what, that was the other question, so do I
Wait,
just
wait
leave
for
it
the-
alone,
unless
don't
the
discuss it?
Reinforce it.
Yeah, okay,
At that moment, don't. Now, if it's a burn, you know,
okay,
if we don't have pictures yet, whatnot, we need to really undress everything. and
cause
get
Colton
some
tells us
pictures
not
and-
to undress the kids until they take them down.
Yeah, and we do that for a reason.
So we don't undress the kid burns?
No,
Okay.
do not. Now, if nobody's seen, usually we've got pictures by that point. The, referring hospital, we usually send Dr. Coleman, so he has a ballpark idea
Okay.
of what he's,
Cause he says
Yeah.
don't unwrap it
When you
cause it
say
hurts.
don't undress them, you mean the burn or don't undress
no,
the
the
kid?
burn,
The dress.
whatever the problem.
When
is.
Colton-
I was asking if
When
you,
Colton first
send
came,
them
the
to
very
surgery
first
dress.
patient, he says, do not
I was wondering.
undress
Yeah.
the burns on the
Burns,
kids
okay.
because it's, we have anesthesia for a reason.
yeah,
Okay,
it's very,
yeah.
it is
So-
very painful, and we just have, years ago just made the decision, why put them, we know the child needs to go to the OR.
That's what I'm hearing.
What difference does it make if it's 6% or 12% at that point? It's not gonna change the fact that he has to go to surgery, so we'll just deal with it down there. That child will be first case,
Yeah.
so just keeping,
And it's okay for us to document, cause I mean, that's part of my thing, it's like, how do I document? All right, I've got this here, but I can just say, extremity wrapped,
Yes,
mhm.
reinforce, whatever,
Yeah.
you know,
and just leave it.
Per
physician, do
MD,
not,
dressing's left intact.
and you can reach out to the APP at night that's on call if you've got those questions. Like you said, you don't know what you don't know till you have it. And, cause I know you feel at night when you don't know what to do.
And if you're missing an order, our APPs are still kind of learning what orders they need to do here, how to do them. I think they've gotten better from what I hear, but we're still missing some things. So if you see something, call them. You missed this order.
And you can maybe pass this on our diet orders, there's a pediatric diet that's
Oh,
more
yeah.
pediatric friendly.
Okay.
They put in a regular diet, it's gonna be,
Like I said, there
the
is a
pediatric is more
Okay.
pediatric
We really
friendly.
worked with our system to get some
Pediatric friendly.
friendly stuff like nuggets and
I bet they
mac
probably
and
don't even know.
cheese and things like that instead of broccoli.
So when you hit
Cauliflower.
diet, it'll come up pediatric.
Pediatric.
And then you go down and you put, do you want them a regular, clear,
Okay.
but it'll still be.
And see, and we're
Yes.
used to not even managing that. We had dedicated
Right.
nutritionists, and they handled, from the point that patient walked in that door
We,
until discharge.
we
they
do a
handled all that.
consult if it's a burn, cause it's an automatic consult for
Yeah.
nutrition, but they still have to have a diet put in.
Okay.
Yeah, and then they can add it, change or whatever, but. Yeah,
That's an easy one.
that was our only thing that people really weren't happy with was the diet, and I couldn't blame them.
And speaking of, I just want you guys to know, talking about people, patients, families not being happy. I looked at your HCAP scores yesterday. You guys have some of the best HCAP scores I've ever seen.
Oh, yeah.
I was shocked.
We try.
And I brought these if y'all wanna just look at them as you're going around.
I think you have a
Awesome.
98.
Yeah.
We love our jobs,
I was like, wow.
and we like to take good care of our patients, and hopefully they feel that, and I
Oh,
think
yeah.
they do.
Yeah.
Mhm.
But we just hear that
And
other
one
hospitals just say, oh,
yeah.
those big patients, they don't do anything, they haven't made, da. No,
No.
we don't, we work
They just-
hard.
Well, they don't know.
They don't know.
They don't know.
Well,
They don't
and
see it.
Nicole Bailey made that comment to me when I was making my manager
Yeah.
rounds one day. She said, I have a whole new perspective of this floor now. Now
Yeah.
that I've been on this side, I see
Uh-huh.
what
I
they're
wish we had a
doing.
higher sample size.
I know, and that's one thing I was gonna say, y'all just, and, your staff too, and even downstairs, when y'all get down there, remind the staff to remind the patients to send their surveys
Yeah,
in.
we do.
We're always, send your surveys in.
Is
Um,
so are they not doing the telephone surveys with the?
Well, they do, but these are the ones that are sent in. And pediatric patients are we send surveys to 100% of our patients. That doesn't happen on the adult side. They just randomly send them to patients. But we send them to 100% just to try to get our numbers up.
I'm not at a point where I do it yet, but once we kind of get designated and
Yeah,
our office work settles down, I like to round up every single patient
yeah,
of ours every day personally,
oh, yeah.
and I push that survey.
Any other questions that Robert Mike could ask? That Robert Mike could answer for y'all while
You
we've
guys,
got this?
my number should be up here somewhere.
Yeah.
If you guys think of anything, seriously, for you guys, night crew, it could be 2 o'clock in the morning. Call me. Don't text me because it's not gonna wake me up. Call me. I won't get mad.
And if you don't mind, like as I'm hearing things, I'd like to reach out and
Yeah.
ask you for
Yeah.
clarification, because I think a lot of issues that we've had over the past few weeks too is just we're hearing something from this person and something from this
Yes.
person and
It's just a lot
And
of
it's so
noise.
much
Don't listen to-
miscommunication.
yes, don't listen to the gossip mill.
So it's hard where if I had someone I could just go to and say, hey,
Stop
how
it-
does this
Stop what you're doing,
work?
call me right then, and
Okay.
we'll work through it.
Well, thank you for coming.
Yeah,
We got a
Appreciate
bunch
it.
of other stuff I'm sure you're not interested in
Yeah,
this
and
morning, but
serious-
thank you so
Yeah,
much.
seriously, you guys call.
Thank you.
Thanks.
I know y'all have to get in bed, so we're gonna go through this stuff quickly. Do y'all feel better about that stuff, or with what he said, or? mean,
I
with the
do,
stuff-
but I'll be honest, I'm scared,
Yeah,
thinking about this trauma stuff. I just wanna make sure that we're prepared,
yeah, well,
you know,
and we're
and we'll
gonna,
get,
yeah,
yeah,
we'll
get
talk a
there.
little bit more about that. The hospitalist changes, with Dr. Myers leaving. Y'all may already know about the doctors that are coming. Jasmine Sandu, that was at Central, will be doing half the week, like her Dr. Myers week. Jasmine Sandu is gonna split the week with Melinda Noble. Now, Dr. Noble, I don't know those of you that met her, but she's one of the physicians that works urgent care. You've met her, I think. I
need to
love
visit
her. I'm really excited that she's gonna be one of them.
She is very.
Yes, I'm really excited
Dr.
about
Sandy
her.
was my pediatric hospitalist at Merit Health River
Yeah,
Oaks for
yes.
5 years. I love her.
Yes, she was
She's
the one that
great.
worked with them,
It's
so,
for,
yeah. And so she did a lot of their stuff. Little concerned about her getting back into that, but,
This is just for us.
Okay.
I mean, for the other staff that's not here, so
okay.
they can hear everything and see everything.
But she did everything for them, and I hope that that doesn't happen again for half a week, every other week, because the others aren't gonna do that, you know?
Right.
So I hope that,
Dr. Biggley will stay just the same.
yes. But I will say that, I know last week, like, she didn't take this patient, the 15-year-old. And I wanna say about the leeches, that saved his finger.
he said that
Oh,
he
he
may
did
still
lose
lose it.
He may still lose it, but they said, Tuesday, was it Tuesday or Wednesday? That it really was looking good. They were optimistic about it. If he hadn't had the leeches, he would have lost it for sure. That was his only hope, so.
That's my major
Hopefully.
issue is, what if we didn't do something right on, with the leeches, that would cause him not to have such a good outcome, because we are not, and I know everybody's gotta learn, I'm
Yeah.
not scared to learn.
Yeah,
But do we learn on a kid that's gonna lose his thumb possibly?
well, you've got resources,
Right.
okay?
Well, most of
And
the
if
time
the
it is.
leech is on there and it's getting fat, then
It's working.
It's getting
As
the
long as
blood.
it's not down there.
Yeah.
That's the thing.
It's
Make sure
supposed
it's
to
on
be
the
distal.
Yeah.
What if it goes down there and we don't know? I mean, it's just all these things and I just think,
Yeah.
which I'm not scared of.
Well, I think
don't
once
care.
it attaches,
It
it's
doesn't
not gonna
de-attach.
slide.
Okay.
It's-
It's not gonna,
So it doesn't release until
unattach
you
and slide.
unattach it. You have to
No.
unattach
When it gets
Okay.
full, it'll drop off.
it'll
Okay.
drop off.
Okay, see,
And at
That's
that point, have you had a chance to read
Yeah,
the
put it in
policy?
alcohol.
not yet, because yours is my first day
Okay.
back, and we were busy
You
over
drop
there.
it in the alcohol, and that kills it.
Oh, I meant to ask, how often do they do this?
Not very often.
You know what I'm saying?
Where do
It's just
where do
like
they come from?
Florida.
Florida. There's a farm in Florida.
They come from pharmacy.
The pharmacy,
They're
the
expensive.
pharmacy, yeah, was,
I
the
figured you
tech
just
was
got
up
them
here.
from UMC when we needed
And do
them.
you keep them in the refrigerator, or where do you keep them?
I don't know, they're in pharmacy, and they actually have to do something.
They had to change out,
Yeah.
this girl was up there, she said, it's just like we got little pets down there.
Yeah.
They had
I
to
mean,
change
they're like
out
a
the
cake,
stuff.
I mean, what do you keep them in until
They're
the
in
next?
little specimen cups when they come up.
You just keep them in the ring, I
They're
mean,
supposed
yes.
to be kept, I think, at 50 degrees.
so in the fridge?
Oh, really? See, I
Read
think,
the
Okay, well, I
policy,
said time, it was busy
and then it
yesterday.
tells you, you kill them because you don't reuse them. If it falls off, you don't I mean, if
Okay.
it's full or whatever,
If it's big and fat, you don't
yeah,
reattach.
then you put it in there
Fan
and
it
it
up before
kills
you
it.
kill it.
Yeah. Yeah.
You get for this is your last meal.
Last meal, yeah.
You don't take it home and go fishing with it?
Ugh.
We just don't want to think people, the hospital people, to think that
Yeah,
we're
I mean-
scared of doing it, but we're not. We
But
just want
nobody
to know.
knows about this. But
Oh,
well,
yeah,
Oh, trust me.
They talk.
That,
well,
yeah.
they can talk, but who else around here? I don't know of any other floors
Okay,
that even
they-
know about the leech stuff.
You have all these float pool nurses that are coming here. I mean, everybody talks.
Well, guess what? I'm over float pool now.
I don't know who's saying.
I'm just saying,
But I'm
no,
just
I'm not
saying the
saying that's gonna stop them, but
co-workers.
by the way,
Yeah.
just so y'all know,
You get some big mouth female nurses. Okay.
well, I don't know.
Big
I'm
mouth
just
just
It's
talk.
all
gonna
good.
learn.
We talk- It's good, but we're not scared. We just want everybody to know we're not scared to do anything. We just want to be talking and do it.
Yes, okay, so with the hospitalist changes, besides that, last week when we were in our subsection meeting, after that, we had a meeting with like Dr. Sullivan and Dr. Quigley and a few other people, and he was very clear that the hospitalist would be accepting patients. That is part of this program, and if they're consulted on a patient, they are expected to accept them. And, so he made that very clear.
Can we possibly maybe get it in the policy that like when we get a surgical admit for a lap appy, that they've got to consult the peds hospitalist
No.
if it's a peds patient? Because the only time I've ever had trouble at night getting up with a doctor was when it was like a surgeon that I have to call the answering service, and then they, if they do call back, they're mad because I disturbed them in the
Well, I'm
middle of the
sorry.
night.
I'm sorry, if they're mad about that, they should have consulted the peds hospitalist.
It'd be nice if all peds admissions could go to the hospitalist and then
certainly-
consult surgery.
We could certainly, suggest that, and I could take that to the general surgery group. I'll suggest that, but we can't,
Mandate.
yeah, we can't make them do that. I mean, we would like for them to, yes.
Yeah.
But yes, that was Dr. Sullivan's point. You know, if these physicians are in clinic, they can't be here taking care of their patient and overseeing everything. That's what you're there for, is to oversee their care and let that physician in clinic know when something goes wrong or if they need something. And that's what this program is about. And that's what we've been about since the beginning, and maybe things got misstrued at some point, but it is expected. And so, that, we'll see how that goes, but, so they should be accepting, these patients of Dr. Coleman's. Even if it is a trauma patient of his, they're still admitted to him, and they have to be for trauma reasons. But they still can consult the hospitalist for pediatric. Okay, we talked about the one-on-one, the trauma program. We actually have a survey coming in June for the trauma program. There'll be some training coming. I don't know that we'll have any training for the survey. Maybe we will, I don't know. Michelle Goreth is the, program, director for that, program manager for that. I know some of y'all have met her. She is a great resource. She's someone that could actually come up and do some education for us if we identify some things that we need.
She's got some peds experience.
She's a pediatric nurse practitioner.
Yeah.
She actually did a lot of,
Okay.
did some trauma stuff at UMC, and so she could be a good
So if
resource.
you get in touch with her, do we just,
Just let me know or let Amy know.
cause we don't have her,
We got her on speed dial.
we don't have her number or anything? No, I mean,
Just let us know, and we can get in touch with her, to come do some education. She's offered, I feel like we need to let her get past June. We got a lot of stuff going on in June. We may have a joint commissions survey coming in June, like unexpected. And then we've also got our magnet survey in June, so June's going to be a busy.
so we need to take off the month of June, right?
June's gonna be a busy month. So with growth, I just put on there, we don't know what that's gonna bring with the trauma destination. I do feel like it'll be some higher acuity patients with us doing, a higher level of trauma than we have had. Now, we're not going to have these massive car wrecks with major trauma. We're not gonna be getting that, cause we don't have critical care, obviously. But surely we're gonna get something higher acuity than what we've had, you
Let's
know,
say chest tubes, are we gonna get a peds for the chest tube on the floor?
possibly.
We've had them in the past,
Yeah,
but
we've had them. Remember Denise admitted one at night one time?
Dr. Myers, the gal put it in, Brandon Myers. With these traumas and stuff, now, you know, we don't have Foley catheters for kids.
I know, we're looking at all the
Okay.
supplies. We're looking at all the supplies that we would need for, from Foley's to chest tubes to, you know, way down the road, Dr. Cullinan's talking about A-lines and all this stuff on down.
That'll be
He's
in
trying to,
ICU.
yeah, he's trying to get us to critical care eventually, but that's on.
Only reason I
down
bring
the
it
road.
up is because one of the burn nurses said that, but the baby that was admitted during the night
Yeah.
should have had a Foley. But she
Any
didn't
other
need a Foley.
supplies that y'all could think of? I know Foley's were on our list and,
That stretch
Chestnut.
netting that they, I had tried to get it before Colin came, but then his card in here has the netting, and I like to put that over like IV sites and stuff.
it's just that whole
Yes.
netting.
Yes, like a
It's like a
singular.
sleeve.
It's tube, yeah.
Yeah,
Yeah.
they
And
have
it's
it
different
there, so we can
sizes.
get it
When they
now.
go down to one north, if they're gonna take that cart with them,
We
we
need some
need
of that
to be
stuff.
able to stock some of that, so I
Well,
don't know where
we
that
need
came
to
from.
keep that stuff.
That's theirs.
Well,
The big,
well,
it's
I
on the
thought
big
we
card.
had some in our lock thing.
Oh, that's all their stuff. None of that is ours.
But I thought we had some of our own supplies in that lock
Mm-hmm.
thing.
I mean, they use both of
They use
those.
both of them.
And I frequently,
No, no,
I don't know if the other ones do, I will go down to Central Supply, they'll say, hey, we're
Well,
glad you're
just
here,
get
will
us-
you get, but they ordered
Get
that
us our
special
own
stuff,
Stuff of supplies,
Or
so
get-
that we'll have,
so
our
I need
own
to
when they
get,
leave.
we need to get ours and put maybe over on that other side, you know, that
Yeah.
has like that.
and we need to keep that lock cabinet for us, cause
well, that's
it's
what I'm
ours.
saying, yeah.
Yeah, don't let them take it with them when they go downstairs.
No, and keep it with burn supplies.
But
for
that
patients
stuff
that
that's
we
in there
need.
now is what they use.
Now, the tubular netting, are you saying the size they have in there is not good for us?
No, they've got every size in there. They've
Okay.
got
We
from
need
the
to make sure we have
baby
some.
size
Okay.
to the full torso size.
Okay.
Yeah, so we need to
So
have
In
at least one
peds,
of
we
all
use
of
like
them.
you know, like if you wanna put it over
over the
an IV,
Instead of Coban, which is great.
yeah,
I like Coban.
But we have Coban.
We do, but
Don't we?
Coban gets tighter and
Yeah.
tighter,
Yeah,
and that does not.
okay.
We'll
So,
be together this next thing. and we'll-
I got a box of
Don't
that
we
and put
have
it over by our computer.
Don't
because
we
I
have
put it on this
another
kid last night.
cabinet in there that would, lock cabinet, don't we have two in there?
there should be one over there and one
So
over
why
there.
can't we get the one of them and get what
Change
we
the
want
code on
and
it.
put it in here or somewhere
We'll
We
see.
gone.
in 2 weeks or whatever,
2 weeks.
supposedly.
Yeah,
Yeah,
well,
that's why we
actually,
just
a
need
week
to-
from Monday, they're supposed to
But we
be
just need to
gone.
make sure that we keep those cabinets, cause it was hard to get those cabinets.
See who will be here
The 15th.
the weekend before they're gone, and then who will be here on the 15th to make sure, or put a sign up that says do not take. You know, but they shouldn't take our cabinets because they were ours
But they have
anyway.
their stuff in them, so we, you know, everything comes up next and
But-
around here
We put supplies in those.
for them.
Yes,
We
for
we
them.
use,
Y'all,
So-
please don't let chairs disappear.
what,
No, let me bring that up while I'm thinking about it. Two things while I'm thinking about it. Any chairs, rolling chairs, that are messed up,
all of them.
all of them?
We got rid of messed up chairs a long time ago, and now
They
They
brought
brought
them
them
back.
all back.
it's like someone's taking the ones that are
Good.
good and
And
Bringing it
just
straight
FYI,
out.
See that
if
happen?
I'm on the
You
camera,
don't see it happen.
I went to Fort A when they were closed and got us 2 chairs that were not messed up and brought them over here.
So do we still have them?
I don't know.
Okay, see what's out there that's messed up, and let me know how many chairs we need recovering. Or how many chairs, are they so messed up that we need to
They're
get rid
horrible.
of them?
Get rid of them.
How many?
I don't know.
That's
We'll
what
go
I
look.
need to know. How many, And then if y'all see these chairs disappearing, let us know like then, okay, today I noticed this wasn't here yet, whatever, and we'll look on the camera and see who's
It's
getting our
hard,
chairs.
I mean, it's hard with all the commotion going on,
Yeah,
but I mean, once they're gone, they'll be easier
Yeah.
to keep up with.
Yeah.
yes,
But yeah, and we
So-
even put pads on the back of our chairs, and none of our chairs have pads on them anymore. When we first got those new chairs, we took a marker and put pads on the back of them.
You need to put Apple tags on them.
Yeah,
Yeah, we do have some RFID tags that they put on like the cribs and
Mhm.
stuff, and some of the more expensive equipment, and it dings when it goes out the front door. So if we'll do that, the other thing quickly I wanted to say, you know, you can wear t-shirts on the first Friday of every month. We're getting Hospital Week t-shirts, and you'll be able to wear those next Friday. Just FYI, we've gotta go sort those t-shirts today, so you'll get those next week for Hospital Week. There is a whole list of stuff going on next week for different shifts, just all throughout the week, so you'll be seeing that come up next week. And then you've probably seen some people wearing sweatshirts that say Baptist Nursing. TC sells that sweatshirt. You can wear that Baptist Nursing sweatshirt on the first Friday of the month. That is the only day you can wear that sweatshirt or a t-shirt. Not on the weekends or any other days of the week. I know people are doing it, but it's taking time to get it out to everybody. Pharmacy, radiology, everybody, it's just taking time to get that out to everybody. We talked about the higher acuity patients. I don't wanna skip that, cause I know that's bothering Kim. We don't know what we're gonna get. When the trauma, you know, when we start looking at that a little bit more, I do want Michelle to give us some idea of, if we're a level 2 or 3 trauma, what would you expect us to get? You know,
That would
What-
be nice, that way
what
we
would the
can
top
kind of.
5 things be that you would expect us to have
So it
it
won't be a
vetted?
surprise.
So we can be prepared.
Right,
So
so
we feel
what
like
would
we're
you,
not,
what would you expect us to have, and, so we can, you know, so I'm gonna ask her that. She's been gone this week speaking at a conference, trying to let her get through the June thing, and then let her come and talk to us about those top 5 things and what we should expect from that. Cause I feel like she'll know. If she doesn't, she'll know where to find it. And then, you know, like I said, that program, do y'all want me to email you the link where you can at least look at that program that we were looking at through ERC? It does have to be purchased, and it's like so much per person. So I don't know how much, if you click on the link, I don't know how much you can look
So
at.
what does it stand for?
I have no idea.
Or what is it gonna, is it for,
It's like a company that, I don't know, but like
I don't
NICU
know.
has it too, ENCCO.
is this gonna
But
educate us on traumas and stuff?
what, I don't know, I haven't looked at the PED stuff.
I
don't know
haven't
if you
looked
have.
through it either.
What
I
this
clicked on it
is-
and didn't, and then I had to do
So it has
something to get
different
to the
things.
It
There's one
teaches
on
about,
NICU, there's one on peds, there's one on adults.
Okay.
it's geared towards critical care type
Okay.
nursing, but it's good information to get,
Yeah.
to give
So it's
you
not
some
PED
base
specific
knowledge. So
necessarily.
like,
Yeah,
my
No,
NICU
this will be
nurses that
about
come
peds.
over that don't have NICU experience have been assigned this to get their base knowledge
Okay.
of, you know,
even if it's about critical care
Babies.
peds,
to
It
know
won't
what
hurt
they've
you to-
been through.
Right,
to
when they
look
come to
through it.
us.
just to know, some basic information.
like in NICU, it goes over like electrolytes and, you know, just the different
Right.
aspects, respiratory stuff. So I would assume the pediatric part
Probably.
is going to touch on all those kind of basic things.
So can education help us find some good, sites for trauma, peds trauma? I know we can look them up and all, but,
And Michelle's the one that Fountain McGorth is the one that sent us this.
okay,
So, I know there are some trauma courses. I just don't know how deep we wanna go in that, because we're only going, our peds is gonna be a level below what
I don't
the
know.
hospital is gonna be. So, also, if you go on HealthStream, you can go to the catalog, and search some stuff.
Okay.
There's
Yeah.
probably some stuff in there that's free that we could pull up. I have not looked yet, but please take, if you have some time,
Major did that with
look in
burns.
there.
Yeah.
you know, look in there and see what
Okay.
they've got, or like top pediatric trauma.
And if we do this ENCCO stuff, just so y'all know, like, it's expensive, it's like $500 a
Per person, yes.
So, and it comes and it has like all different, like Nikki, you had like 23 modules and all. So it's not one of these health streams, click, 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 click and get through it, you know?
Yes, yes.
It's to
Learn
learn. I
to build that
mean, you
knowledge
know,
base.
Yeah.
not just,
Yeah, please don't go click through it. If you're gonna do that, let's don't
And the NICU
sign
people
you
that have
up.
done it, I've had Lisa go through it just as an experienced person, so she could give me an honest answer about how it was, and then the new people. Everyone's given me very positive feedback, said that this program's really good. So I'm hopeful that the ped side will be
Yeah.
just as well.
You don't have to have like X amount of years of experience.
It's just educational.
Yeah.
Yeah, like my NICU nurses, new grads are taking it. Shelby took it. I don't know if you've met her.
Are you a new grad, Kayla? I didn't think so. I thought you had experience, are you from?
But she hasn't had
Batson?
the peds experience.
Okay,
That's what she said.
okay.
Just like with certifications, you have to have, usually have to
Oh,
have
yeah.
2 years or
Yes.
5
Yeah.
years.
Yes,
certain
yeah.
amount of
This
hours.
is just strictly education.
Yeah, this isn't a certification.
So educational needs, I know I told Kim if anybody has stuff they wanna write down as you think of stuff. I know Kim had put down heparin, like the
I
neuro
mean,
stuff.
we'll
You
discuss
have-
that in a minute.
You have it? Okay.
We can check on that baby, cause we haven't, yeah, I'm gonna check on that baby.
Certification, if it, you know, just mentioning that if anybody feels at any point they want to pursue their certification in pediatrics, we can certainly, get with education department and pursue that. We're gonna be having a magnet blitz come up, and these, couple of things I wanted to leave about magnet, because they're going to come up here on different shifts. They're going to select so many people from night shift, so many people from day shift to have lunch with them, to have breakfast with them, and they're going to ask staff questions. They're not gonna be asking us. So this is our notebook. I'm going to ask Amy to start putting stuff in. You didn't already have a notebook, did you?
Yeah, I put
Did
one on
you?
the unit,
Okay.
yeah.
Well, I
But
just
that's
got this
okay.
from Bethany, but do you have anything in it yet?
I do, but I
Okay.
mean,
I just
I can
brought
add
some
to
stuff. I
it.
didn't know if you had this in it.
I
It
don't
said
remember
leader
what,
stuff,
yes,
but-
I put that in
Okay.
it,
What about this one?
and I was, no,
I
that's
just
not.
put,
This
is-
may be, I can't remember, I'll have to
I'm gonna
look,
give you
that's
that
in
to
it.
put out on the unit. This is our blitz. Do you have one for NICU?
I do.
And anywhere, put it in the bathroom, somewhere.
Okay.
Everybody has to go through a blitz, you know, and it's fine if you do it. We've got some at 5 a.m. We've got some that go till 9 p.m. at night, so we're trying to hit every
That way
shift.
y'all can see it and
Yeah,
after you get
Those
done.
are all on my off week.
well, major.
I'm just saying, that
Yeah,
I'm not here any of those days.
And it's going to be a blitz in the atrium where you go through and there's the different, were you here last time when we did that?
Okay.
You've been here a long time, haven't you?
5 years.
Must
But,
have come
I
right
mean,
at the
I
end
probably
of-
just missed it.
Right, yeah,
Because we got delayed with COVID. I
Yeah.
know Teresa was here, but the blitz that we go through just to get everybody ready. This is one of the handbooks I wanna leave on the unit so that y'all can
we
look
gotta,
through
we
that.
gotta post these.
I was
I
just
passed
telling
them
her that,
around.
you know, they're gonna talk to
Okay.
staff. There's gonna be people, selected to go to breakfast with them, to go to lunch with them. I think they picked 25 people to go to lunch and breakfast each day.
They're voluntold to go down there.
I know Rachel's gonna be an escort.
The good thing
Take
about
them
it is,
around.
it's our week off. When they come.
Hey,
Don't-
sometimes
I've already
towards the
checked,
ease
I'm
during
just
that.
saying, we do
Don't
have to come up
Sometime
and do the
towards
blitz,
ease or education during that.
I don't know.
but
I was hoping it was
Both
during
your
my
patients-
cruise, I was gonna be in this.
Both the
Are
patients
you
of mine,
here
yours
during
is up
the,
eating. Mine will be
survey?
ice cream.
I don't think
I
so.
took up both of them.
And if y'all put this up somewhere, that's just
I've
about
already had people trying to figure out if it falls.
Nurse of the week, Nurse of the year is presented on Monday, May the 8th, since it starts. Nurses Week and Hospital Week falls the same week, which I never liked that. The Quality Board, that's where you'll find some of the information that magnet surveyors may be asking you. If you don't know, you don't know, but I know where to find it. So you could go to the board, you could go to your notebook that Amy's put out. So if you don't know, or SharePoint, get on the internet site, so could be in any of those places. The patient satisfaction, I brought this for y'all to keep, just to look at that, and there's lots of great comments on there. We talked about Hospital Week, Nurse of the Year, told you about chairs, the sweatshirts, and then we've got an employee survey starting on the 15th. I've heard a lot about it. I don't know how long it's gonna run, usually it's 2 weeks maybe. But we haven't heard a whole lot about it, but do know it starts on the 15th. Anything you have, Amy? I tried to, think of any, hand washing, I do wanna mention that since it's supposed to be on here. I know, we all know about hand washing, but it's still always a thing. We have secret shoppers that come around. And do you remember what she said our hand washing was? It needs to be 100%.
It was 100%.
I mean, for us, but I'm talking about hospital-wide. It was not
Oh,
100%.
hospital-wise, I have no
I
idea.
mean, it needs to be 100%, but it wasn't, and you would think it, I would think it would be, but I wanna say it was like 70-something.
Yeah, I can't.
We gotta order isolation carts on Lawson. I don't know if y'all are already doing that, but that's something that has to be done now. You don't call for the isolation carts. You order them on Lawson. On there, you don't put in the diagnosis. You just put what type of isolation it is.
Can we get on Lawson?
Lawson,
I
that's,
thought that was like.
I started
where we
saying,
print paychecks and
where's
stuff.
Lawson? I
Yeah.
don't
No, that's
know.
bought.
Can
That
we,
would,
but can we get in Lawson because,
I don't know.
no, but
but she's not here
Charlotte
24/7.
can. When she's not
Charlotte.
here, then you'll just call another floor's
You
clerk
can
and
get-
ask
yeah,
them to
Get
order it.
another
Okay.
clerk to do
Yeah.
it. But just
Okay.
tell them what type of isolation and what room instead of giving the diagnosis. A lot of floors are telling the diagnosis and what room, and
They
that's
don't know, yeah.
yeah. So,
Okay.
anyway, that's something about, that's the way they can track it. That's what it is. It timestamps when you order it. Cause people are saying, I called at 1 o'clock and it didn't get up here till 9 o'clock. There's no way to know that.
So once you
Put
put
it
it in the computer, like the patient's on isolation, they don't automatically send you one? Cause like when,
That
No.
used to trigger
No.
a,
so that's, we'll change something.
You gotta
Okay.
order the cart in Lawson.
okay.
Med carts, they're coming up on the 15th to service the med carts, so they needed to be cleaned out. I know ours aren't like everybody else's, so it's not gonna be that big of a deal to clean those. But on the 15th to the 19th, they'll be coming up sometime during that week to service the med cart. Externs start the 25th, around the 25th. Of course, we don't have an extern this summer, but I would think we're probably gonna have externs want to come over here. And, I'm just gonna share with the other managers, and Amy can. It'd be best if they call, and plan it on days that they know we're gonna have patients. Don't plan it weeks in advance on their schedule. So if they'll plan it more like tomorrow or that type thing. Cause I do know that we'll have people wanting to come over and observe. And then on our carts, some of you might remember this from Joint Commission, but they have to have the plastic on the bottom of all of our metal carts. Just check all of our carts and make sure they do have the plastic pieces. if they don't, let Amy or I know, cause we're in the process of ordering the plastic pieces to go on the bottom of all of our carts.
Burn one doesn't have it on there, I don't believe.
I bet it doesn't,
The
cause
rest
it's
of them
new.
should, but that one, but yeah, 'cause we replaced them.
The one in the nourishment room have one?
We put one on unless, yeah,
Okay,
but we'll check them.
yeah.
Cause we put one
The
on all of
ones
them last
in the
time.
treatment room probably do not, cause
Cause
those
they're
are
new.
new carts.
Right.
I bet they don't. And just let us know if it's the big cart or the smaller cart, and those should be the big carts. And then remember, just always be in joint commission ready, I always have to say no cardboard, cause you know we got dinged for that one time, so we'll never forget it again.
Make sure you're doing the checks and
Yes.
all that, cause
Remember
we're in
the
that window now.
Yes, we are, and if they come in June, oh my gosh, what else can we take in June? But, because the diabetic survey could be any day, and they could go to any floor, and Lord help us, if we have a diabetic child, when they come, they'll be up here, cause that will be a perfect opportunity for them to hit peds and diabetes at the same time, so, you know, if you have a blood sugar that's not within normal range, when do you go back and recheck? Within,
30 minutes.
yes, and that is not being done housewide, so I know they're gonna obviously probably get us on that. And the AccuCheck machine, we don't have to worry about this, but if you go in more than one patient's room, what would you do?
Wipe it
Bleach
off.
wipes.
Yeah, wipe it off, or you can put it in
In the
one of those
bag.
plastic bags. And then cleaning equipment, we wanna use manufacturer's guidelines, or with the cleaning wipes or any cleaning, solutions, use the manufacturer's guidelines for the times and all of that. And I'm just thinking of stuff off the top of my head. I know y'all know, but when you get asked, you get,
The last time
Flustered.
the wipes were expired.
All of the
Hospital
bleach
wide, I
wipes,
think.
yeah.
so
and I know you can check every day,
You're still gonna.
but we'll be running through here like crazy people the day that they show up.
Keep checking the med room, cause it keeps breaking. It doesn't lock, and they came yesterday and fixed it. For some reason, the lock is, and you can just push the door open. So every time I come back to work, I have to get them to fix it. And it's gonna be an issue with Joint Commission if they step in the door, the med room.
So what's,
Wait.
Security.
Maintenance comes and they fix it, and then the next day it's broken again. And to put a maintenance order in, you have to do it on the computer, you
Yes.
can't call anymore.
they just started that
Yeah,
this
I
week.
did, yesterday.
Sink.
But I don't know what it is, it's something with where I don't know what they're called, Major probably knows. The lock, when the lock goes into the other, I can show you on that door,
The magnet.
the magnet is detaching and it doesn't lock when you shut it. So you can just push it open instead of vacuuming.
So they don't think they need to,
Maintenance has come probably, I don't know, at least 6 or 8 times.
Yeah. They,
And I keep telling them, y'all say it's gonna work and it keeps breaking. And they keep,
Joint Commission comes
and I
up
said,
and
join,
does
and
it.
I check, every day I come back, I check, and I usually have to let them fix it.
But you know what, are you putting that in the computer?
Now I am, cause you have
Now.
I started saying, if we start doing that, there's a paper trail.
Yeah.
Things
to.
might
Yeah,
get.
as of yesterday, that's what I did yesterday, cause that's the only
When I
way.
come back tonight, show me how to do that maintenance thing.
She'll have to show me.
I'll have to figure out
Because
if I will.
she
It's
challenged, because
hard.
I was
They
wanting
walk
to
me
call
through it,
yesterday.
it's hard, but I'll show you, we'll figure it out. Just remind me.
Yeah.
But you gotta put it in the computer, and then you get an email that they got it, and then you get an email that it's fixed.
okay, Amy? And just FYI, if anybody, just family, if y'all are interested or wanna spread the word, there's some family festival in Flowood at Liberty Park on May the 13th from 4 to 8.
Okay.
I know Baptist is having a table, y'all. I think it's like a family fun night or something. I'm sure it'll be advertised out there, but our ENT people are gonna be there, and there's pediatric stuff and all. Amy, do you have anything else?
I don't think so.
I feel like
I
I've been
do.
talking.
I have a random question too.
Yes.
Go. No, you go.
We-
How are we getting the word out about like these extra patients, or or peds patients at all, because like before I came here, I didn't know that there was other hospitals in Jackson that took peds,
Okay.
because we're getting a lot of patients from elsewhere, you know, like Hattiesburg or
Yeah.
whatever.
Well, Candace is our physician relations, person. And she covers 82 counties in Mississippi. And so she's out every single day of the week, going to places, promoting pediatrics and every other service here. I was out with her Tuesday, and we went to Carthage. I mean, we're constantly going out to places and promoting pediatrics. Every time we have a new service added, which I've told some of y'all that Dr. Danko will be back May the 17th. Her private practice opens in Canton on May the 17th. She
That's
bought,
orthopedic surgeon.
yeah, pediatric orthopedic surgeon. She used to be here. Now she's opened her own private practice. She bought a building on the square in Canton, and it is so fine. She has remodeled it, and anyway, it is really
So
nice.
Are we
She will
gonna
be.
get kids with the ISIT thing on their knees and like sports injury type?
Were you here when she was here?
No, but I got a kid at River Oaks. All the orthopedic patients went to another floor, but one night I got a teenager, and there was this
No.
thing that was on her knee, and you had to fill it up with ice
yeah.
and pump some
Mhm.
water through it.
We had,
And the dad had to show me how to use it, cause I've never
Oh.
seen one of those before.
Yeah,
Oh, wicked.
we use those on orthopedics. When
She
I was
never
the
used any of
manager
those
there.
on hers.
But she doesn't use those.
But she does have specific stuff, but we'll get with that when she
Yeah,
gets here.
she, well, she just left in July. Were you not here before
Well, I
July?
guess I never had any.
She had like, she did a lot of, osteo, the hip of that little boy.
Yeah.
You didn't have him, he was
She'll
there
do
forever.
club feet, she did several club feet.
Broken leg.
Yeah,
I don't remember her.
And she did
Fallen
some-
arches.
yeah, she,
She'll create arches in their feet.
she does anything orthopedics, but, and then next Friday, we're going to Columbus. So we do a lot of outreach, you know, constantly, but it still seems like people will say they don't know about us.
Maybe they should
We
do
do
a commercial.
marketing. Look, let me tell you, we also have marketing, and we take all this to our marketing people, and some of it gets turned down. It took me 4 years to get a billboard put up until they would agree to do a digital billboard. And, you know, we may get to run another digital billboard, but it ran for, 3 months, with Dr. Myers on it.
These patients that we're getting like from Hattiesburg, most of them are burns, and
Yeah.
Dr. Coleman goes and he hands my brochure.
Yeah, he went to
Well,
every ER in the state.
And
I
they
think.
know about him from him having the burn center at Central,
Yeah, so we
because
get
that's the
lots of
only burn center in the state. You know, and that's gonna help us spread the
It will.
word also, because, you know, those patients, they have other things go on. They'll
That's
know.
all.
Yeah.
We send this kid to the Baptist, they have peds.
So
Yeah.
Candace is out there every day of the week, and I go with her. We have our critical access hospitals that have emergency rooms, and they still send patients to Batson some. So we're working on that also.
I'm just asking. Two more things. We've been like out of snacks. I had to go hunt down some Jell-O last
We're
night.
gonna get with Charlotte,
Oh, she's in charge of that?
Mhm.
Okay.
Yeah.
she's
Is
got,
she not ordering enough?
she hasn't been recently, and I have not been here, so I'm not gonna,
Yeah,
all I know is
I
very,
got
I
a
They go
charge
through it
list
quick,
yesterday.
too.
Okay.
don't know,
I mean-
I haven't been here, so.
I didn't look at it
Those
yet to
adults
see how much she
Don't
was
wanna
using.
eat what they're
They don't.
mixing up, so they eat snacks all day long, is what I've been told.
Me too, I mean, when I'm at home,
It's stuff like Jello, and we need for the
Yeah.
kids too, like Jello, and she can find Jello. And I didn't have time. We try to look in the morning, but yesterday with being the one nurse there and one nurse, even though we only had a few patients, it's still busy.
Yeah, so maybe she needs to, and they'll be gone in another 10 days.
That's the thing, just hold on.
And it's
10
the
more
weekend,
days.
so we really need to do a good order for the weekend.
Yeah.
And would you make a list of supply of nurse and whatever, and just put it like where she sits,
Mm-hmm,
and that way she'll see it in the morning. You don't put your name on it, just make a list.
Okay.
yeah, if
Yeah.
there's ever stuff you know of, just leave it at the desk there.
That's what we do with Miss Gwen over there. We just she comes in and there'll be a list of stuff for her to order.
And that goes for supplies too, like if you're out of, I don't know, tape or paper or whatever, just make a list, cause she orders down there that we get Nikki to order it.
Okay, and then the whole issue with Dr. Body and how she almost like bleeds out her patients.
Her last 4 patients have been very
She
bad.
almost what?
We've had to give blood to Dr. Body's patients, the last 3 or 4.
Did the one last night have to have it?
Well,
I don't know, she had H&H. She was really weak when I got her up and
her
then
blood pressure dropped.
her blood
Her,
pressure
her
dropped.
patients have been bad.
They have been. They don't do H&H's,
Maybe it should be like a standard thing. We should check their H&H. I don't know.
yeah,
But like
they're
she
in,
almost fell. And I'm like,
it's just a,
we can't, you know,
Will she be
they're in
up here
surgery
today?
they're in surgery for 10 hours sometimes.
Yeah,
did she
I-
what?
well, she'll be up here.
Well, she
this
may have already
morning.
come, I don't know, but yeah, her patient's still here. But the last few have had blood and have had to stay extended time.
So she doesn't order H&H's on any of them?
They shouldn't order pre or post or anything.
And like her note says like
If they're
50.
symptomatic?
50 ml.
Well,
Well,
she's symptomatic.
Yeah,
and
she
you'll
called
get
me
one?
this morning and she
Okay.
got an
And she
order for
ordered an
stat
H&H.
H&H.
What, it just says call if she's symptomatic,
We
or
have
you can get
parameters
it?
for vital signs,
Yeah, but they're pretty like
heart rate over 120.
That's a lot high for an adult.
Yeah, it's gonna take
Yeah.
a lot to get there.
Her patients have just been sicker than normal. Even though they're healthy adults, I mean, they're healthy, like that, she
They're
was
just coming
48.
back from surgery, like,
And because they're under anesthesia for so long, they're nauseated, which we could deal with all this, but every one of them's having to have blood, and
So do you, if you see her out here today, do y'all feel okay asking her if you could get a standing order for H&H, or do you want me to ask her?
you can ask her. I mean,
If you don't mind.
I mean,
You don't wanna ask her?
I don't mind, I'll ask her. I mean, Kim has her today, but I mean, I'll ask her.
Or yeah,
He has a patient today, 'cause
Um,
I have help today.
I would just say, since you've got, well, the last 4 patients needed it, could we go ahead and get a standing order for an H&H on these reductions?
Add it to her
I mean, I think that's valid,
order set.
yeah.
and I think Dee had one come up that really was probably
She was
more, she was
ICU.
real bad, like she should have gone to the unit
She sure should have.
bad.
What age was she?
She was a teenager, she was like 17, 18.
Oh, is that, yeah, last week.
I don't
Was it last
remember.
week? She was here for like 3 days.
No, that was well, unless it was
Or
a
over the
different one.
weekend.
That may have been a
last-
different
this is-
one, but we had
yeah.
one that I would, cause you had her,
The 19-year-old?
Yes.
Yeah.
Yeah,
No,
she-
this
that's
is
the
a
one I'm
different
talking
one.
So
about.
that's a
She was here
different
like weekend before last.
Yeah,
She's-
this is a different one.
She's
This
had-
has been a couple of weeks ago.
she's had a
and
lot of patients that have been.
Dee was like, they shouldn't have
Mhm.
brought her up from PACU, like she looked like death when she got.
And Packy will say, hey, she's fine, she's awake, she's alert. No, she's not. She just can't wake them up when they get to the room. Because like I say, they're under anesthesia for so long, they keep them for a very short time in PACU and then they send them up. But I think Bonnie had maybe talked to the PACU nurses about that one.
Yeah,
Or that
she-
one of them she did.
She was upset about that one, cause she said that it shouldn't
never
have
should've
ever
came
come
out.
to the floor.
Right.
And so Bonnie was contacting PACU about it, but anyway, I do know her last few patients have
Have
been
been sick.
really bad.
So you'll talk to her today and let me know, if you don't, what happens, if she
Okay.
says okay or not.
They need to keep them longer in PACU. And I know they're ready to go home, but they're still not stable or coming.
They do that everywhere.
I know they do.
That has forever been a problem. They send the patients to the floor before they're really ready to go to the floor.
'Cause these people are under so long.
I mean, if you feel like they send them to, you can put it in Oscar. If their vital signs are not stable, they were not stable, you put it in Oscar.
Well, her vitals are stable. She was just very hard to arouse.
Yeah,
And then she was getting rigorous, but that's part of anesthesia. And that's what I tell
Yeah.
the daughter. It's just, she's fine. It's part of it. But then,
When she got weak, like, I'd rather know
that
that
was
she's,
8 too, so that wasn't that long after I left.
yeah, I'd rather know, you know, her labs are low, let's treat this and not get her up and let
Right.
her possibly fall,
Put her on basic mode or whatever, yeah.
not see these things happen throughout the night, you know, like, let's go ahead and get ahead of it and fix it.
But see, they don't get a pre-H&H, so.
You don't know where.
I know,
You
I
don't know
know
where
why
they
they don't
started.
do
Why
line
wouldn't
work.
But I'd still rather
Why
have that
wouldn't they
after,
do
because
that
we know
for
what's low.
Andrews?
I don't know, that's what I'm gonna ask her.
Uh-huh,
Cause I mean,
But
they,
more importantly, the after.
Yeah,
yeah. Okay. What you got?
okay. After, we had talked, you had me to put up a note just saying, please list anything.
Yeah.
This is what was compiled.
Okay.
Will there be a psychiatric, pediatric counselor available for children
There
for
is,
trauma?
okay.
You know, with that kind of thing.
Well, Michelle Goreth is taking care of every bit of the trauma stuff. She knows everything that is required and is taking care of every bit of that. She is on top of it, believe me.
Will we receive communication guidance to talk with patients and families who have experienced trauma appropriate?
All of this trauma stuff, Michelle's got it, and she's gonna be doing education.
How will we screen children for mental process related to injury? Acute
Like, you
stress,
mean
disorder, post.
injury, do you mean their trauma?
what caused the trauma probably, like down in PTSD or whatever. I mean, these are from these are not from us, these
Yeah.
are from
Gunshot wounds from the club or.
being hit in the head
I
by,
don't see us getting gunshot wounds, no.
but like if somebody's
Well, I mean,
a trauma,
A 16-year-old gangbanger shooting me out of
know.
PG.
I lost my thumb, that's trauma.
yeah,
I think, we didn't compose all these, this is from,
yeah.
I think that's what they're talking about, like trauma, something that happens that's gonna cause,
Everything trauma related on here,
Michelle?
I'm personally gonna refer it to Michelle
Okay.
because she is going to do trauma
that's probably all
training.
trauma, I think, isn't it?
A lot of it. And, you know,
Um,
they're asking for a mentor for pediatric nurses who have never cared for trauma patients' injuries. Will a preceptor be available, you know, for unfamiliar task? And is there like a checkoff protocol for learning these new skills? Who's gonna be responsible for precepting new hires on this kind of thing?
Well, the thing is, what checkoff would we come up with? So y'all tell me what checkoff.
We don't know what we're gonna get, so that's hard to say right now.
Y'all help develop a checkoff. What would the checkoff be?
I guess we get with Michelle, cause we don't know what to expect.
Yeah.
What
I
would
mean-
the checkoff be? Do you have any idea what checkoff
No,
we would
because I don't
come
know
up with?
anything about any
I
of it.
mean,
I mean, is it gonna be an
Yeah.
ongoing one that we're gonna add bleach therapy, heparin therapy? I mean, cause it's like he said,
We're
it's
gonna get
a,
a
the
kid-
different-
we don't know until we don't
Are we
know.
gonna get a kid with an exterior ventricular drain?
I don't know.
Do we have a neurosurgeon?
No, we're not gonna get that. We don't.
Uh,
And it's
I
like
mean,
it-
we're
the-
not gonna get anything that we don't have a
Right.
physician to cover. I will tell you, a pediatric psychiatrist starts at MCAM this summer, either July or
They
September.
make-
She came up here, some of y'all were here.
She's not already on staff, cause
No, cause she hadn't even moved here yet.
well, they had made an appointment for my granddaughter, but she's got an AC, but she pulled her out. Anyway, but I'll find out when. I'll call Kaylin later.
Is it not, who is it?
I don't know. Cause I wasn't with Kaylin when Rivers she pulls her hair out. So her doctor referred her to a psychiatrist at MCAM.
I think that's trichomania, tritryptomania.
That's why she's going bald. I'll find out from Kaylin
Okay.
if it's now. So she may have already, I don't know.
I
'Cause I
thought
thought-
she started in July. Dr. Cardenas left
Oh,
at the end of last summer. They had a psychologist,
This is
Lisa
psychiatrist.
Roberts, and another one
Yeah.
that left. But, gosh, I can't think of
I'll
her
call-
name.
I'll find out today.
Or-
Cause
Yeah,
Dr.
find out.
Jones referred her to, and said that she would be getting a call within the next few days. And it's at MCAM and it's a psychiatrist.
The
Rivers only
psychiatrist
4.
came the day that, the two twins came. The
I
two
wasn't
twin physicians came, I don't
Oh,
know
no,
who was up
wasn't here.
here, but they're developmental.
Well, I'm glad
One
they're
of them's
getting one.
developmental and one's a general pediatric, physician, and they're all
So we will have
coming.
psychiatrists that will, are they gonna come
Yeah.
to the
They
hospital?
can consult. Dr. Quigley talked to her in detail about that. I don't know to the extent of this. All the trauma is gonna have to go through Michelle. I have
Yeah.
not even been trained on the guidelines for the trauma program, what PEDS entails. They've been working extensively on the application process and on the survey process.
So this is nothing
until
we're
they-
expecting to get right away.
We're not gonna be a PEDS behavioral health unit, are
No.
we? We're not gonna get,
Well, we can't be.
So is this
We're-
psychiatrist
You
gonna
gotta have
actually
like a state
come to
certificate.
Yeah,
the
we're not
hospital?
doing that. Huh?
Is that psychiatrist gonna come see these kids in the hospital? Cause you know the,
We've asked, I
asthma
asked her
doctor
if she
does
could do
not.
consults, and she said yes.
but did she come to the hospital? Cause we do consults
Dr.
with,
Rodriguez came to the hospital when we did the food.
right, but pulmonary, he does not come to the hospital. We refer them and they go to his
To see
clinic.
him first, yes.
So that's what I'm saying, like if we need somebody in the hospital, do we know if this psychiatrist is gonna
I
be
asked her and
willing?
she said yes.
Good.
But now when she starts there, they may tell her something
Okay.
different.
Cause we've needed it for a long time, I mean.
But we're not going to turn into any kind of psych
No, no,
unit.
but,
But I told her, we need somebody to consult when we get these suicidal patients or overdoses from the ED.
exactly.
I mean, we need somebody to say, yes, we can send them home. or
Sometimes these
refer them to somewhere.
Chronic abdominal pains,
Yes.
they consult psychiatry, and
Yes.
we have nobody that will come
Like
see them in the
The
hospital.
one last
She's
week.
an adult, but, yeah,
Well, yeah. But this one would have been better
for her,
served than SVH,
exactly.
you know.
Okay, good.
What about PTOT? The other day,
Yesterday morning, with this 23-month-old burn patient, PT, I guess it was PT, came, cause there was a consult. He says, I don't know what they want me to do, cause she's only 23 months old and she doesn't walk. I says, number one,
She doesn't walk.
I said, number one, she does walk, but number two, she's in surgery, so you gotta come back. He says, well, I don't know what I'm gonna do. And he never came back, the kid was sent home. And I informed him that they really need to get some education because this is gonna happen more frequently, and that they
Yeah.
would be consulted. I don't know who it was, I was busy, I didn't ask him his name. So that's gonna be an issue if they
And
don't
let's
get
start
some.
getting names,
I will, it was just, yeah, I will.
just so we can say, you know, I can take it to David
Okay.
who's over.
yeah,
He may be here
Okay.
today because he has patients over here. I'll get his name. But she can walk, 23 months old.
Yes, the respiratory, they've already been involved in this stuff, so they've already.
will a patient acuity rating scale be used to determine the nurse to patient ratio? Will the unit be required to go on diversion for a 1-to-1 admission?
No,
Will a dedicated social worker be equipped to handle the pediatrics population's post-discharge needs?
we are meeting with case management and social work on the burn, patients and, just pediatrics in general. I don't know what their capability is. They don't have the ability to have somebody up here
We don't have the volume, I don't think.
and,
But-
so.
But they just, I mean, when we do have that patient, we need someone that is knowledgeable.
Well, there is no
Right.
one, and they're not
Hired
even,
Darius back.
they don't even do a good job on the
Darius
adult
was
units.
great, but he's not here no more.
Will
But
there be a
that's-
written policy criteria for accepting or declining patients to the pediatric department? Do we have written policies criteria already in place?
We do have, yes, we have a policy for, are you talking about for the staff?
This was left for us.
Okay, for the staff, no. There is a policy on pediatric admission policy. It does not talk about accepting or declining patients. But our admission policy is very vague. It just says they'll be admitted 17 and under to the pediatric unit, vitals, it's very vague. Michelle Gorth and I, actually, we were gonna meet last Friday, but then that meeting with Dr. Sullivan and the hospitalists and all took our time and we didn't get to do that. But we were going to rewrite the admission policy.
So,
No, that might.
so maybe this is, so if we get report and we think the child is not stable enough to be admitted, who do we reach out to? I mean, who's gonna,
Well, if it's a trauma patient or something, they would have come through
to
the
the
ED.
ER, okay.
So
We're
that
gonna
would
get a
have
directed
already
hit from
So we won't get
the
it.
taken.
Yeah, like if, so all traumas, whether they come from another hospital, they'll still go through our ER. Is that what you're saying?
If it's a trauma patient, that the trauma activation,
Patient, they'll go through the ER.
yes.
Okay, so that will prevent a lot of that. Yes.
But we are rewriting the admission policy to include a trauma admission.
Okay.
Policy to be included.
What will be the criteria for admission to ICU versus the pediatric floor? Age, type of injury, involvement of body systems?
So there won't be any because we're not taking any ICU patients.
Okay. We need further education regarding awareness of signs of potential child abuse. What are the state reporting requirements? How do we chart, and this is, I mean, how do we chart stuff that you may not necessarily want the family to read in Epic? You know, because if we
Yeah.
chart it in the note,
They can read it.
Yeah,
so
but
we need that,
that's,
we need to know that.
yeah, I'm gonna have to ask about that because everything you chart in Epic, they're gonna be able to
And
see.
where-
Can they read the observation? Someone told me
They
that
can't read the flow sheets.
The flow sheet, and that's where
And I think there's a way to flag your nurse's
can.
note that it
You
can't
can't
be.
You.
read, I'm trying to think from when I was looking at my dad's stuff.
You can read the notes that you write on the side.
Yes, but you can't read
the
the flow sheets.
observation, yeah, so on the flow sheets, on the bottom of the vital signs, it has observation, that's where I do my narrative.
Not that it happens a lot here, but with us having trauma, it might. We're afraid that if we chart something and the patient can read, that's gonna let the patient's family know that we suspect abuse, they're gonna take that child out of here before we can contact whoever we need to contact.
Or maybe
Like
there's
say-
stuff that's destroyed or hidden or
Well,
whatever.
But we
My
don't want them to see
personal
that.
recommendation would be to call social work and get them involved in reporting this before you ever document it. That would be that's what I would do personally.
Okay.
And they're
If
not
you're
gonna say,
afraid
have
of
you
them seeing
documented
it.
anything, or we can just say, no, we're not gonna
I mean,
document
I'm
anything.
documenting it now or
Right,
whatever
okay.
and get them involved.
That was one of the main
That's what I would
concerns.
personally do.
We don't want
Now,
them
you
to see it and say, okay, they think I'm
I mean,
gonna
I
leave
can
before
certainly-
VHS.
Ask
But this
some
is just,
Epic professionals
Yeah.
about that and ask my colleagues at the other facilities how they go about doing that. Cause we've got a system call next Wednesday.
So,
So
like
I
on that
can,
mission thing, it is that risk factor for abuse, they cannot
Yes.
read that? Like
I
the
don't know.
admission,
I don't know.
I don't think
I
so.
don't know, yeah,
I've
'Cause it's
never
a
been
flow
able to
sheet.
read that from looking
cause that's
like
a question on
my
that admission sheet,
dad's,
if you think.
you know,
yeah.
chart. And it, I mean, from my chart, I've never been able to see that.
'Cause we can't hold them without, I mean, we can't tell them they have to stay.
But I think this is just a big question, and it doesn't have to be something that's right now, but I mean, as a PEDS department, especially if we start getting
This
busier,
is also.
it's something that would be good for our unit to know. We need education on it. You wanted to know what we wanted education on.
Yeah.
This is one of
Scan
those
this
things
and
that,
email this to me because I can also email this to, Michelle,
okay.
because most of this is trauma stuff that,
I may add a few other things.
and I'll take the things out that aren't trauma, like the PT and
Okay.
respiratory, I already know about that. You know, the acuity rating, I'll just say the hospital overall has been looking at acuity rating scale. I don't know that will be done unless Michelle knows something within the trauma program that's going to rate that. If it is, I don't know because I have not. You can go on the Mississippi State Department of Health and read the trauma guidelines. I have not done that yet. Like I said, I don't, she's gonna have to be able to answer some of this stuff.
Okay.
Answer that one.
And so, anyway, but that, you just wanted to know some of the things that people wanted education
yeah.
on or whatever. And this was sort of a thing that was compiled And some of this, I mean, you know, we've got the continuing education, and they had also listed, you know, this Emergency Nurses Association course, Introduction to Trauma Caring for Pediatric
Where's
Patients.
that?
It's on the, it may be on
Oh,
your
on the back.
back.
Yeah.
And I think I answered most of the
Now,
others
is
that I wrote.
this, something that somebody found somewhere?
Yeah, that's what they had found. It's a continuing education thing for pediatric nurses.
Just where, do you know where they
I
found it?
don't know.
Or,
I think they
Okay.
probably found it.
I don't know.
okay, well, I mean, we can certainly look that up and see what's involved in that. I do encourage y'all to go on HealthStream and see what they've got also.
Right,
There may be some stuff on abuse that's helpful, and I don't mind looking up some of that stuff. If I find it, I can try to assign it to you. Some of this other stuff, pediatric services available in the area, the A, B, and C, these are good things. Definitely, we did this in orthopedics when I was up there, because we had all the joint replacement patients. We had a whole thing in the back of our book that listed every PT, like outpatient rehab in this whole Jackson Mastro area. So I think that would be
that
good
does
for us to find
pediatric, not,
these resources for peds, and any of us can do that. All you gotta do is Google, write them down, address, and we can type them all up and keep them in a book. I mean, and provide that if we need that for parents.
Yeah.
Same with psych, there's not very many. We probably need to go statewide with that, cause there's not that many.
right.
I've heard of a few lately that I didn't even know about, and then inpatient rehab being the same way. And as far as occupancy limit for mass casualty type events, I don't know that there is one. I'll ask Robert Ware about that. In a disaster,
Do
I
what you gotta
think
do.
you are gonna work at the best of your ability, cause you're gonna have all hands on deck, and it's gonna be.
Everybody's supposed to be able to come in during that time too,
Yeah.
supposedly, but I
So
mean.
I don't think there is a specific limit
Have y'all been
in
working
a-
on
in a disaster.
policies, cause I know our policies for peds are so vague.
Well, I'm actually going to be over policies and procedures for the hospital and system. And then also, I lead that system Lilly committee, which is our pediatric. And we're working on pediatric policies for the system.
Some are outdated and stuff.
Most of them should be up to date.
Okay.
Because I went through our peds policies just last week.
Okay.
And Brandy Ware had them all updated, not to even be renewed till 2025.
Okay, good.
So, I think we need some more
Is there any
robust
way that,
policies.
yeah, and I'm changing the subject though, but like to have one of the staff members like to be a champion, you know what I'm saying? That, you know, maybe you can get some extra resources or, you know, education that we can go to for pediatrics. You know, it wearies me thinking, okay, we're gonna be calling this or that or whoever, you know, for a resource, if it's not a pediatric type thing. As we get
Okay.
going, you know what I'm saying?
So who specifically are you talking about, like?
Just even one of the staff members, you know, someone that has some true good pizza experience.
JC had worked at 2C for 10, 12
You
years.
know,
Yeah.
knowing more
Should be
of
good.
what to expect, hands-on type thing. You know, I know we can do this type of thing, but it'd be nice to have someone that would say, hey, come and show me how to do this here, and they feel comfortable on a pediatric patient. You know what I'm saying? I just don't know, like a chest tube or,
We're just not gonna have anybody like that, Kim. There is nobody here like that. You know,
Yeah.
if we say you said JC, well,
They're staying here 24 hours a day.
no, and
Right.
it's been a long time since she's done that too.
right,
It's going to have to be self-driven. I mean, you're gonna have to research it,
and just,
educate and learn hands-on. as we get it. And this is what Dr. Sullivan was saying last week. The best, oh my gosh, I told him I should have written this down. The best education is something he was saying basically is, the best
do it.
education is hands-on education.
And I'm that way. Instead of somebody just telling me something and reading it,
Or
I
something
wanna
about,
do it. I
the
wanna
best
see it
experience is
all
patient
remembered.
experience, or something like that's what he was saying. Cause I was like, I want, to get the staff educated, but some of it we just won't know until we get it,
Right.
and then you're learning as you go. And
You know, as long as we have a resource that I can say, this is not, I don't feel like this is in my scope. I don't feel like I'm competent with this. But if I can say, okay, Major Combs from 3 North here to, do whatever I need, you know what I'm saying? I'm talking about a CYA thing. If it's something I don't feel comfortable with.
okay, if you get a patient with a chest tube, okay, all you need is a
Right.
nurse that knows how to do a chest tube. It doesn't matter if it's pediatric or adult, it's a chest tube,
Right.
okay? You
Right.
can call the education department,
Yeah.
they teach that
Well,
in
and
orientation.
And I'm just
But-
trying to think of something
And
that
I'm
I
just
wouldn't.
using that
Yeah.
as an example. You can reach out to any adult floor, reach out to me or Amy, we will find someone that works with chest tubes a lot to help you out, okay?
You
And
know
that's
me,
just
I'm
one
like, I wanna make sure.
That's just one example,
Right.
okay? If it's on night shift, reach out to the supervisor, reach out to rapid response. Say, look, I haven't dealt with the chest tube in my entire career. There are things that you don't run into for a long time.
Right.
Maybe you've worked NICU your entire career and never had anything like that. They have, have somebody come up, because say a chest tube, it's not gonna matter if it's an adult or a kid, it is a chest tube, and the basic operation of it is the same. And I'm just using that as an
Right.
example. So don't feel like you're in a silo, even though it's pediatrics. Nursing knowledge, a lot of it is the same knowledge-wise for a skill. So don't be afraid to reach out to some of those resources.
And if that's not available, where do I escalate?
If who's not available. A supervisor and rapid response are here 24/7.
Okay.
They're,
Yeah.
well, when the only time a supervisor's not here is when Amy and I are here.
Right.
And we're typically not off at the same time. If we are, there's somebody
There's
covering.
somebody, yeah.
Yes,
Are the supervisors and, rapid response required to have PALS now?
they are all getting PALS. The ER, they're working through all their people getting PALS. Radiology's working through their people getting PALS.
Okay.
Surgery is working through, it's taken time to get all these people trained. But yes, everyone is on the list to go through PALS.
The burn patients and stuff, they need.
Oh, and all the burn
Yeah,
nurses.
I knew they were
are-
good, but
are
I'm just
on the
saying
list.
with the burns and traumas, everybody, they don't really need to have PALS.
Yes, they're on the list as well. A lot of the float nurses, and then anybody that's being hired for burns is having to get PALS.
Hopefully I've covered everybody else's
And then one more thing,
questions.
which,
Well, if
And
not,
I look
email
like
it.
I'm the,
No, email it. Email it and scan that to me,
okay,
or email it if you've
I
got it
got
sent.
it, yeah, I've got it.
Because I wanna send it to Michelle, because she could probably spout off all of this. If we need to set up a time and get her up here, she loves to talk
she
now.
does, just save her. The code cart supplies are hard, they're still on back order and a lot of them are expired. We've ordered them how long ago?
Oh, those modules.
I mean, but we haven't
But
taken
I
them
thought
out.
they had I'm thinking of the pads.
No.
They've got
The
those
modules,
in
right.
now, the modules.
There's
The
nothing
modules
we-
are all on back order?
Well, we've ordered them,
It was a long time ago.
I mean, and we haven't taken what's expired out because this my codes, you need something, I mean.
Yeah.
Well, I'll get Nikki to look at
Yeah,
it.
could they?
Cause we
at
Amy's
least
been working
check
on
to
it, yeah.
see what the status is?
get Nikki. to look
And,
at it.
yeah, I'm only checking ours, I'm not checking whole hospitals, what do you mean?
I'll send out a reminder to some of those people.
I'm sure they're expired too.
Yeah, I know the ER's following up on theirs.
How they getting supplies?
We gave the information to order, either Julie ordered them or something.
We've ordered them several times.
I don't even remember, cause it's been so long ago.
I was just, I don't know what else.
I didn't realize that they were like back ordered or anything.
We don't know what that one.
But you can get the individual supply, you don't have to
Right.
have that module, you can
Right.
put individual
Which maybe what we
things in
need to
the
do is just
car.
go and take everything out and just take stuff from Central, but they're not gonna have the
I wouldn't throw the module
Yeah.
away for sure.